all the people who join us in the webinar number 187 since the Andean Health Organization Hipólito Unanue Agreement started a cycle of webinars in May 2020. It is already 3 years of continuous learning. At the Andean Health Organization, Convenio Hipólito Unanue, we promote health and wellness, as well as social and environmental justice. We firmly believe that the One Health approach is indispensable to achieve the highest possible level of health in our population. Likewise, the COVID-19 pandemic taught us the capacities built and strength must not be rolled back, that health must remain at the center of policies, research, epidemiological and genomic surveillance, the development of vaccines and drugs, and the deployment of health promotion and prevention measures are essential for a caring society. Reflections on these and other priorities relevant to health and well-being can be found in the Noti Salud Andinas newsletter, monthly edition, available on the Andean Health Organization website. Today, Thursday, August 31st, 2023, we are going to deal with a very important topic, health of the Afro-descendant population, past and present, thus highlighting the importance given to this topic in the Andean region. We invite you to leave us your name, organization, and country from which you are joining us through the comment box in the Facebook chat or YouTube live chat. In the same space, you can leave your questions or send them via email, webinarhorasconju@gmail.com. To access the certificate of attendance this webinar, as usual, must fill out a short survey and leave your data in the fixed link found in the Facebook or YouTube live chat. Please verify that your email is spelled correctly. The certificate will be sent to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greeting, then the presentations of our speaker, active pause, and the space for Q&A. To begin this important day, I will give the floor to Dr. Maria del Carmen Calle, Executive Secretary of the Andean Health Organization Hipólito Unanue Agreement, to give the welcome and institutional greeting. Go ahead, Dr. Calle.
¿Estás con el micrófono apagado? Ahora sí.
Okay.
Me estoy pareciendo a ti, te estoy diciendo, pero tú siempre estás con el micrófono
You always
apagado. Bueno, hola,
Well,
Gloria. Gracias.
Hello, Gloria. Thank you to all the speakers.
En los países andinos,
In the Andean
la
countries,
diversidad
ethnic
étnica
diversity
constituye
constitutes
una gran
a great
riqueza
multicultural
Sin
richness.
embargo,
However,
las profundas
the deep
desigualdades
social,
sociales,
economic,
económicas
and health inequalities
afectan a diversas
affect
poblaciones,
various populations,
entre ellas la
among them
población
the
afrodescendiente.
Afro-descendant population.
Estas desigualdades
These
persisten a lo largo de
inequalities
tiempo
persist
en la
over
mayor
time
parte de
in
nuestro
most
continente.
of our continent.
Pese a los esfuerzos
Despite
de
the
los
efforts
estados
made
y a las
in
políticas
the global,
mundiales,
regional, and
regionales
national
y
policies,
nacionales, los procesos de
the
exclusión y
processes of
discriminación
historical
históricos
exclusion and
continúan.
discrimination perpetuate.
Se perpetúa la precariedad
The
y la
precarious living
exclusión
conditions
social
of
en
a
gran
large
parte de la
part
población
of the
afrodescendiente.
Afro-descendant population.
Reconocemos su gran
We recognize their
contribución en
great
la
contribution in
geografía
the Andean
con
region
sus costumbres
with their
y
customs and
tradiciones,
traditions,
tal como hoy se conoce en las diferentes
as we know
expresiones
in the
culturales,
different cultural
así
expressions,
como con sus
as well
sistemas
as with their health system
con
that,
rituales y
with
creencias,
rituals and beliefs,
tecnologías e
technologies,
instrumentos terapéuticos
and traditional
tradicionales
therapeutic
como
instruments
rezos,
such as
plantas,
prayers,
ofrendas,
plants,
entre otros,
offerings,
son
concoctions, among others,
identidad
are
cultural,
part of the cultural identity
definitivamente suman a
and
la
add
salud de
to
nuestra
the health
población.
of our population.
Desde el organismo andino
From the Andean Health
OHIP, es decir, el
Organization,
convenio Hipólito Unanue,
Hipólito Unanue
se da un
Agreement give a
preponderante
prominent
lugar
place
al tema a
to
través de
the
la
subject through
Estrategia de
the
Salud
Andean
Intercultural,
intercultural health
así
policy,
como del
well
análisis de la
as the
situación actual
analysis
de
of
la
the health
población
situation of the
afrodescendiente,
Afro-descendant population,
cuyos resultados se han
whose results have
evidenciado en
shown
problemas de salud
frequent
severos
health
en esta
problems in
población,
this population,
tales como la
such as high
hipertensión
blood pressure,
arterial, los problemas de
cholesterol
colesterol,
problems,
la diabetes, los
diabetes,
problemas
and heart
cardíacos.
conditions.
Contamos con un
We
plan
have
andino de
an
salud
Andean
para la
health
población
plan for the
afrodescendiente,
Afro-descendant
el mismo
population,
que será
which will
actualizado
be
para los
updated for the
niveles
period
médicos del 2030
2023-2030,
y que sin duda alguna
and that with no doubt
arrojará los
will collect
resultados
the
de este
results of
webinar
this webinar
para que contribuyan
to contribute
sustancialmente a ello.
substantially to
En
this
el presente
document.
webinar tenemos como
In this
ponentes
webinar, we have as
tres
speakers
representantes
three
de la población
representatives of the
afrodescendiente,
Afro-descendant population who
analizarán las
will
condiciones de
analyze the
vida
living
actual,
conditions and health
pasado y
past and
presente,
present,
que permitirá
which will allow
establecer
to
recomendaciones
establish
dirigidas a
recommendations
incorporar
aimed at
acciones que
incorporating actions
respondan a las
that
necesidades
respond to the
específicas de
specific
la
needs
población
of the
a lo
population
largo del
throughout
curso
their
del
life
día.
course.
Saludamos la presencia de
We
Manuela
welcome the presence
Mosquera de la
of
Asociación
Manuela Mosquera
Internacional
from the
Interétnica de Parteras y Parteros
Association of
del Chocó,
Inter-Ethnic Network of
Colombia.
Midwives of
María Eugenia
Chocó,
Quiñones,
Colombia.
médica
María
ancestral
Eugenia
de Ecuador.
Quiñones, ancestral
El doctor
physician from
Mario
Ecuador,
Izquierdo,
and Dr. Mario
coordinador de la
Izquierdo,
salud de la
health
Mesa
coordinator of the Afro-Peruvian
Afro-Peruana
Working Group
del Congreso
of
de la
the
República, a
Congress
quien
of the
les
Republic,
damos
to
la
whom
más
we extend
cordial
a warm
bienvenida,
welcome,
especialmente en este día
especially in
en
this
el
day
cual se
where
celebra
we are
el
celebrating
tema afrodescendiente.
the Afro-descendant.
Muchísimas gracias por su
Celebrated.
presencia.
Thank you very much for your presence.
Muchísimas gracias, doctora Mari
Thank you
Carmen.
very much, Dr.
Luego
Mari
del
Carmen.
saludo de
After
nuestra
the
secretaria
greeting
de
of our
cooperación,
executive secretary,
mi
introduce
nombre es Gloria
myself.
Lagos,
My name is Gloria
soy
Lagos.
gerente
I'm the
cooperativo
manager of
internacional
cooperation and international
del Organismo Andino de Salud,
cooperations of the Andean Health
coordinadora del
Organization,
Comité Andino de Salud
coordinator of
Intercultural
the Andean
y del
Intercultural
Subcomité
Health
de Salud
Committee,
para
and of the
Población
Subcommittee of
Afrodescendiente.
Health for the
Hoy
Afro-descendant
estaré a
population.
cargo de
And
moderar
today,
esta
I
sesión.
will be in charge of moderating this
Tras este
webinar.
preámbulo,
After this
queremos
preamble,
darle
we
la
would like to
bienvenida
extend our warmest welcome
a la Magíster
to
Manuela Mosquera,
Magister Manuela
partera
Mosquera,
tradicional
traditional
hace más de
midwife
20
with more than
años
20
en
years
esta
of
labor,
experience in this work,
acompañando a parteras y
accompanying
parteros
midwives and
tradicionales
traditional
en el
birth attendants
departamento del
in the
Chocó,
department of Chocó,
Antioquia, Cauca y
Antioquia,
Bolívar.
Cauca, and
Ella es
Bolívar.
enfermera,
She's a nurse
especialista en
specialist
organización y
in
desarrollo
organization and
social,
community development,
magíster en salud sexual y
masters in
reproductiva.
sexual and
Lidera
reproductive
la
health.
organización
She leads
Comité
the
de
largest
Salud
organization
Midwives
of traditional
Tradicional,
midwives in
es
Colombia,
promotora en
a
territorios
promoter
difícil
in
acceso y
territories of
directora
difficult
de la
access and
organización
director
de
of the organization of
Comercialización de
marketing of
productos para la
health
salud.
products.
Se ha desempeñado
He has
como
worked as a
consultora y como
consultant
consultora en varias
in
agencias
several United
gubernamentales,
Nations agencies,
destacándose como
standing out as a
researcher.
researcher.
Integra el movimiento Salud
She is
Sexual
part
y
of the
Reproductiva de Colombia
sexual and
y lidera
reproductive
el
health movement in
seguimiento de la
Colombia,
certificación
leading
de
the
partos
process of
atendidos por
reporting of
parteras
birth
tradicionales.
attended by ethnic midwives.
Me señala muy especialmente,
She
Magíster, que es
especially
madre de dos
indicated me that she's a
hermosas
mother of
hijas
two
y
beautiful
mujer
children
emprendedora.
and an enterprising
Adelante,
woman.
Manuela, bienvenida.
Go ahead, Manuela. Welcome.
Saludos para todos, es mi
Greetings
gusto
to everyone.
y
It's a
una
pleasure
gran satisfacción siento estar en
and a
este
big
webinar y más
satisfaction
este día
to share,
tan
especially
importante para
this day that is
nosotros
so
los
important for
afrodescendientes.
us, the Afro-descendants.
¿Qué más que
And what more
de
than
esta órbita nosotros podemos
from this
explicar cómo
orbit
ha sido la salud
we can
antes,
explain
después
the
y
health before
actualmente, cómo
and
estamos
now
alrededor
and
de
after
la medicina tradicional
around
y el
traditional
tema de la
medicine and why
salud
not
sexual.
midwives.
Iniciemos la presentación.
Start my presentation.
El quehacer de la partería
The
tradicional
work of the
llega a un
traditional
momento
midwife. I would like to
digamos,
tell
esta
you
línea de tiempo de la
about
asociación
this
para que
timeline
hagamos un
so
contexto
we
de
can
qué Manuela como
put in
coordinadora
context
considera
why
que
we
la salud
consider that
Afro
health
colombiana,
in
afrodescendiente,
Afro-descendants in Colombia,
de
Pacific,
los
the
afrodescendientes.
health of the
Ha tenido
Afro-descendants
cambios
have had
aún
changes.
como partera, como
As a
enfermera, como
midwife, as a
periodista.
nurse,
He buscado siempre
we have always
profundizar más
looked
para
to
el bien de
go in
nuestros
depth for the
territorios.
welfare of
De
our
hecho, la
territories.
asociación en
In fact,
2009
we have the
decidió
association in
deteriorar
29, a
porque
very
el,
tedious
la Cámara
process,
de Comercio para sacarlo
because
adelante
the Chamber of
fue
Commerce
una pelota entre Cámara de Comercio,
was
sindicatos,
a
no
discussion
sabían dónde
between
colocar
health
las
office
medicinas,
and
no sabían dónde colocar la medicina
Chamber of Commerce.
tradicional,
They didn't know
si
where
hacía
to put
parte de la
traditional
medicina, si
medicine,
hacía
if
parte
it
del
was part
comercio
of
o
culture,
si hacía
part
parte
of
de la salud.
commerce,
En el
or part of
2019
health.
empezamos a hacer
In
un proceso
2010, we
de
started the
articulación y
process of
encuentros
coordination
permitiendo la
through
primera
meetings.
vez
In
con todos los
2012, we
departamentos,
integrated an entire
uniendo a
department
200
with
parteras. Hoy en
1,400
día somos
midwives, that today we
1.545
have
que están en esa articulación
1,500
entre mujeres activas,
midwives
mujeres
between the active ones
semillas que van aprendiendo
and those who
a
are learning
hacer la
this
medicina tradicional
activity.
como
And through
quiera,
traditional
pero
medicine,
muy
they
por
consider
debajo
that the
del
best way
acercamiento
and
para
to get
atender a la
close and
población.
to treat
Logramos
their
que en el
population.
2014 por
In
fin esa Cámara
2014,
de Comercio
finally, it was through the
logramos
Chamber of
iniciar
Commerce,
en
and in
articulación con las otros
2017, in
países
coordination
representantes
with
del
other
Pacífico,
Pacific
logramos ser
organizations,
reconocidas como
we were
patrimonio cultural a
recognized
través de
as
la
a cultural
Secretaría de
heritage
Cultura
through the
y
Ministry of
continuamos los
Culture.
procesos de
And we continue
integración,
with this
de
process of
reflexión, de
integration,
capacitación,
reflection,
diálogo
training,
de saberes alrededor de la
dialogue of
medicina
knowledge
tradicional,
around
alrededor
traditional
de la
medicine,
salud de las
around
mujeres,
health of
específicamente la
women,
maternidad.
specifically
En
mother and child.
2019
In
integramos el municipio de
2019,
Antioquia,
we
conocimos
joined
también a las
the
parteras
municipality of
del Cauca,
Antioquia, and we met
Cauca
with the
y
midwives of
Bolívar,
Cauca
y de
and
esa forma
Bolivar.
empezamos a
And
articular
that way we start
esfuerzos
coordinating
unos con otros y
the
la
Afro-descendants
Asociación
among each
integra
other with this
a parteras
Integra
indígenas
Association
del
with
territorio. Somos
indigenous
considerados
midwives.
hermanos,
We all
porque
consider ourselves
compartimos
as brothers
una
and sisters,
ruta o
and as
transmitir
a
el legado
path
tradicional,
to
el legado que
make
nuestros
use of
abuelos
the
heredaron
legacy
a los
that
pueblos
we have from
indígenas,
this
a
traditional
los
medicine
campos, al
for the
campo,
Afro
el
and
saber de la
indigenous,
naturaleza,
the
el saber de su pueblo.
nature knowledge
Así fuimos
won.
logrando muchos
And
éxitos
we
poco a
were
poco
able
con
to
la
achieve a lot of success. And
certificar
today
en el
we were able
2021
to
logramos
certify in
certificar
2021,
nuestros propios
we
nacimientos
certified our own
y
birth.
evidenciarlo.
We
La
were
pandemia fue
able,
clave.
the pandemic was
Es triste
key.
decirlo,
It's sad
pero
to
cumplimos
mention
con
it
cierto.
because many
Muchos de nuestros seres
died,
queridos partieron,
many of
pero
our
fue
loved ones
importante
died, but it was
para
important
la organización,
for
para la
our
comunidad,
organization and for the
lograr
Afro descendants
certificar sus
to
nacimientos
certify
que
birth
nacen en manos de parteras.
who are
Esto nos
born in the
permitió
hands of midwives. And this
articularnos
allowed us
con el
to
sistema de salud
coordinate with
y
the
aún
health
en el
system.
marco del
And
trayecto
in
de
the
las Naciones
path
Unidas, como era el
with
UNFPA,
United
que
Nations,
estaban al frente de
UFPA,
este proceso,
that were
logramos
leading this
poder
process in
empezamos a
Colombia,
mostrar
we
el
start
número
to
de
show
partos
the
que
number of
pudimos
deliveries that
reportarle
we
a Colombia
could
y
report
decirle
to
aquí hay
Colombia and tell
mujeres
them,
en
here
los
we have
territorios
women
luchando por otros,
in this territory fighting for
sanando
you,
y aún
healing
prestando sus servicios sin
and
esperar
offering
nada.
their services without
Y eso
expecting anything
eso es
in
fundamental
return.
cuando hablamos de
And this
salud,
is very important when
que
we talk
la
about
mujer
health,
entró para
that the
atender,
Afro
para
women
acompañar, a
to
incrementar
accompany and
seguridad.
to
¿Dónde
care
está el
for their
caso?
partner,
¿Dónde está el
they don't
médico?
ask for
No
any
importa lo
money
que vas a
or
darme,
any ID
sino
or
que
what is
ese
what you're going to
servicio
give me.
humanizado, ese sentir
Humanized
por la otra,
service
ese sentir por
is
el otro.
caring for the
Y
other.
empezamos a acompañarnos
So we
unos con otros
started to
sin
accompany
mirar a
each
credo,
other
sin mirar
without
religión,
looking to
sin
whom
mirar credo
is,
político,
without
sin
consider
mirar
politics,
la
religion,
cuantía, que es la que hoy día los
or
países
the
desarrollados
amounts
entran a una institución
or
privada.
money.
De igual modo, fuimos avanzando
Similarly, we were
a
making
través
progress
del decreto,
and through
perdón, a través de una tutela que
the
se
tutelage
establece al
that
gobierno,
was established
somos
by the government,
reconocidas
we are
como
recognized as
mujeres y hombres
women
que
and
dieron
men
partos, salvando
taking care
vidas
of
y
delivery and
dejando
saving lives,
actividad durante el
gave
COVID
our
para
lives
atender a otros
during
y
the
se nos
COVID
reconoce
pandemic to
que es la
care for
legacy
others.
que no se
And this
debe
is a
perder.
legacy
Se
that
le
we should
instaura
not
al Ministerio
lose.
de Salud que debe
Ministry of
empezar a
Health
legislar
should
y
start
empezar a trabajar, a
legislating and
capacitar,
working
a
and
formar
training
y a integrar
and to
la partería
integrate
tradicional
traditional
en el sistema de
midwifery,
salud convencional o
conventional
occidental, como lo
system,
llamamos.
or Western, as
Ese
you
es
want to
el
call
amplio recorrido que la
it.
asociación ha
All
tenido y que ha marcado
and that has
nuestro quehacer, nuestra
marked
forma de ver
our
los
see
derechos
a
humanos.
way of doing health.
Aquí está quiénes somos,
Who
cómo lo
we are,
hacemos,
how do
por
we
qué
do
se
it,
crea la asociación.
why do we
Es
create
una
this
organización sin
association.
ánimo de lucro que
It's
busca
as a non-profit
integrar,
organization that wants to
capacitar,
integrate,
formar y
train,
resignificar la partería.
and
¿Por qué
recertify
significa resignificar?
midwifery to
¿Por qué?
provide
Porque
technology.
donde no hay un médico,
Because
hay
where
una
there's no
partera
physician,
y
there's a
una
midwife,
mujer
there's
o
a
un
woman,
hombre
there's
esperando
a man
servir
waiting to
humildemente, con
serve
calidad, con
with
calma
quality,
y a
with
través de la
warmth,
medicina tradicional a
through
una
traditional
familia, a
medicine,
una gestante,
with a
a un
family,
niño
a
recién
pregnant
nacido
woman,
y
a
a todos.
newborn.
Porque no, cuando hablamos de salud,
When we
no es
talk about
solamente ser
health,
educado o
it's
estar
not only
pendiente
who's
de la
affected
partera, sino
or
que
is in
no
front of the
todos
midwife,
tenemos
what we
lo que es
consider
el
is
territorio, porque
all
necesitamos el
territory,
mismo
because
territorio, que
we
es
need to
justamente
establish a
para que la
territory
familia
so
pueda
everyone is
seguir
healthy,
desarrollando
so
su
the
vida.
family or the woman that we're
Debemos
caring
estar
for
al
is
lado de las
healthy.
plantas,
There's
de
way
la
the importance
importancia
of
de los
plants,
frutos, del cuidar de los ríos, de
the
la
taking
importancia
care of
de
rivers,
articularnos
and
unos con otros,
coordinating
de no mirar si es afro,
on
si es
each other
indígena, de no
without
mirar
considering if it's
de qué
Afro or
territorio
indigenous
viene o a qué credo
or from what
pertenece,
territory,
sino
what
que nosotros estamos,
political
esa es la misión,
current follows or
esa es
what
la
religion they
misión
have.
que nosotros
That's our
tenemos.
mission.
Buscamos
That's a
hacer
vision
este
that we have.
propósito
We look for that
como medicina
recognition
tradicional, pero
as
como parteras
traditional
ancestrales con
medicine,
un
but
saber
as
propio,
ancestral midwife
un
with our own
sistema de salud
knowledge
propio
in
que los
our
desarrolla
own
y
health
los
system
engalana en nuestros territorios.
that we
De
practice in
aquí
our
recuerdo en
territories.
Colombia que cuando la
Territories in
partera
Colombia that when
llega
the
para hacer
midwife
este trabajo, ellos
arrives,
pueden pasar 2 días, un día,
it
y
may,
hay que coger varios
we need to cover
métodos
several days while we
de
wait for the health
transporte
system
para
to
poder
arrive
llegar.
to
Y
different
el
transportation
conflicto
methods.
armado
The
impide
armed
grandemente
conflict
que esos
prevents
territorios
that
puedan
many
tener asistencia de
territories
salud. No
have
es por
health
eso
care.
porque el gobierno no
It
quiere
is
hacerlo,
not because the
no
government doesn't
quiere,
want to get it, it's because
pero
they
allá
can't.
están esas
There
mujeres,
we have
allá
those
están esas
there we have
personas
those
liderando
women and
esa
persons who
tarea,
are leading
acompañando
health process
desde la oralidad,
company
desde lo tradicional,
from the traditional,
acompañando haciendo
accompanying
el
and
milagro
carrying the
de
miracle
guerra.
of
Hay unos objetivos que nos integran,
there's
pero
some
lo que
objectives
quiero
that
mostrarles
integrate
en
that, but
este
I want to
momento
show
es
you
dónde
now
estamos.
where we are.
Actualmente se integra en el departamento
Currently
del
have
Chocó,
integrated in the
Armenia,
Chocó
Antioquia,
department,
Cauca y Bolívar,
Antioquia, Cauca, and Bolivar,
1553 personas
1,556
que
persons
ejercen la
who
partería,
practice
que
midwives,
manejan
practicing
y que
midwives,
conviven con la
and who
medicina
live
tradicional, que
together with
desde un
traditional
comienzo,
medicine.
desde una toma,
And from
desde un momento,
any
desde
activities,
una oración,
prayer,
articulan y
and
armonizan
they
ese problema que hay en la
coordinate and
sociedad
harmonize
con
the
toda la
health issue
cosmovisión del ser
with
humano.
all the cosmovision of the
El
human
solo hecho
being.
de llegar,
Mere fact
la
to
partera se encomienda o el médico
midwife, as soon as she
se
arrives or he arrives,
encomienda a un Dios,
they
se encomienda a su realidad, el
invoke
doble
God
espiritual.
and the
Y
reality,
no
which
quiere
is our
decir
spirituality.
que las religiones o que
But
el
it
nivel
doesn't mean
espiritual
that
esté atacando
religions
a
of
la
the
partera,
spiritual
no,
level
lo están fortaleciendo porque no
is
importa
strengthening
de qué área
midwives,
de
because
de
it
la
doesn't
religión
matter
esté, de
what
qué
area of the
religión
religion
esté,
or the
lo
health area
importante
you
debe
come
ser
from or
que
what
ustedes
territory you
tengan
come.
una
The
unión
important thing is that there's a
entre afros
union
para
between
fortalecer sus
Afros
propios
to
sistemas de
strengthen
salud,
their own
para
health
no
system.
dejar perder sus
So we don't
creencias,
sit and
para no
lose
dejar
our
de poseer
beliefs
toda la sabiduría
or all
que
the
la
knowledge
medicina tradicional
that
nos entrega.
traditional
La
medicine
naturaleza es
can give
infinita
us. The
y solo
nature
nuestro
is
mayor
rich.
cuidado
We
de
need to
empezar a
take more care
escuchar,
of it and start to
observarlo,
listen to it,
palpar,
observe it,
sentir
touch it, feel it,
y oler todas esas
and to
fragancias
smell all
que
those
tiene cada
fragrances
planta
that each
en
plant
cada proceso que nosotros hacemos.
has in every
Como lo pueden ver,
do.
siguiente,
You
esa es
can
la
see in the
serie de
next slide,
hombres y mujeres
this is a
que
large number of
integran
men and
la
women that are
asociación,
part
que
of
integran
this
el proceso de salud
association and of
en
the
cada
health
aspecto.
process in those
En medio,
territories.
un bello
In the middle,
abdomen con un bebé
you see
naciente, una bella panza,
pictures
como decimos
of
nosotros, una
nice
barriga de una
belly
naciente, y con
of a
las
pregnant
manos de la
woman,
partera
and with the hands of a
nosotros
midwife,
trabajamos
we
en
can tell
cascada.
that we work in
No hay
cascade.
escuela,
There's
no hay
no
colegio,
schools, there's no
no hay universidad
universities
que engalane el saber tradicional.
that will
Y
promote
este nivel
this
de
traditional
médicos
knowledge because
doctores
it comes from the
con
territory,
todas las propiedades de las
all
plantas,
the
las semillas y los
properties of
minerales que
plant
conseguimos
seeds
en
and minerals
en la
that we
naturaleza.
obtain in
Usamos
the
el
nature.
ozono,
we
usamos
use the
mucho.
sun, we use the
Todo
moon.
ello converge
All of
en
these
todo el proceso
converges
magisterial
in the
tradicional,
process
todo el
of
proceso
traditional
académico,
midwife
que
and
aquí
the
lo
health
llamamos
process.
como metodología de formación y articulación.
Training methodology,
Siempre hay en un
we
territorio
always
una líder, un líder,
have a
una
leader on
jefa
a
que
territory, a head
capacita, por eso ven
that
tantas
gets
imágenes,
trained,
son los coordinadores,
and
son
they
las
are the
personas que están al
coordinators,
frente del
people
proceso,
who
son las
are
representantes
leading
de
the
la
process and are
comunidad,
the
son
legal
las que tienen los
representatives of the
procesos magisteriales
municipality.
y en cada
Choco
una
has
de las
31
regiones
municipalities, and
desde
in each
directamente del
municipality,
Ecuador hasta
there's
las
a
coordinadoras, que
representative
son las que
and
les ayudan a
coordinators,
replicar
the ones
lo que
who
aprendo, lo
replicate
que
what I
enseño,
learn
ellas
and what I
replican a sus
teach.
parteras que están
They
en el
replicate
territorio.
it in their
Ese es
midwives on their
fundamental acá
territories.
y
This is
que
a
una cosa a
cascade
través del
effort,
comité
and
ejecutivo
through
técnico
technical
tiene
teams
una
and committees
representación legal que
and the legal
permite
representation
es
that
lo que
we
permite
have
esa metodología de
allow us to
formación y
use
articulación.
training
Bien,
methodologies and coordination
entonces
methods.
estos coordinadores son los que dan la voz,
These are
son los que
coordinators,
hablan, son los que enseñan.
are the ones who,
Pero hay algo
but there's
que es
something
muy
else.
importante resaltar. Las plantas semillas
The
más
plants
usadas
and
durante la
the most
gestación,
used plants
antes y
and
después de
seeds,
iniciarse la nacedera.
and they know
Parteras
all these
que
plants.
saben qué
You know
pasa antes,
and use them
durante
before,
y
during,
después del parto.
and after
¿Sí?
delivery.
Esta planta está en
Always.
todo el
This plant
territorio.
is
La
throughout the
partera cuando
territory.
dice me
The
voy a
midwife, when
desarrollar,
say,
tiene
I'm
su
going
tarea,
to
tiene su
start
nicho.
working,
Lo
that's
primero
a
que
niche
florece en su casa es una planta
and
de nacedera. La
an
Santa
acidera
María de
plant.
Anís, que tiene
Santa
varios
Mary
nombres,
of
es
Anise that
muy
has several
importante
names.
para esos fríos, para
It's
ese
extremely
verano,
important for those
toda
colds,
esa armonización
for
también
that
en la
harmonization
familia, en el hogar.
in the
El
family.
romero es un ejemplo de las semillas,
We have an
de esas
example of
semillas que están con nosotros.
other
Esas semillas
seeds
que permiten
that
y
allow
evitan los
and
abortos,
prevent
permiten y
abortions
evitan que el
and
cuerpo pierda su armonización
prevent
en
the
toda
body
esa
from losing
armonización. Las
harmonization.
plantas más usadas con los niños,
The most
el
used plants,
calzoncillo, la
we have
celedonia, la
botoncillo,
hierbabuena, para que haya
rosemary,
salud mental, para que haya buen descanso
lemongrass
en estos.
for
Y
good
así
relaxation,
sucesivamente,
and
siguiendo,
so on.
hay una riqueza
There is
espiritual,
a large
laboral,
wealth of
material, frutas, semillas,
wellness,
que muchos de la
richness
tierra
in
negra,
elements such
que
as the
son,
black
que hacen parte
stone
de
that are
nuestros ancestros
parts
en la
come
medicina
from our
tradicional,
ancestors
en
in
el cuidar
traditional
de la
medicine,
salud
in
de los
taking care of
adultos. La
health
piedra
of the
negra es muy
adults.
típica y
The
muy
black
conocida de la
stone is
población indígena,
typical and
pero
well
en
known in
esos
the indigenous
intercambios de
population,
saberes,
but in
en
those
esa
exchange of
interconexión de
knowledge and
conocimiento de
coordination
las
of
parteras
knowledge,
afroindígenas
the
comparten sus
Afro-indigenous
saberes y ya no
midwives
usan
share
parteras
their knowledge, and
afrocolombianas, no
nowadays
usan la
the
colombiana
Afro
para todo
midwives
lo que
use
tiene que
the
ver con la
black
picadura
stone for
de
everything that
los
has to do with
insectos. Aquí vemos un
snake
tronco que
bites and
duele
other
cuando
insect bites.
nos
We
duele
have
cuando la
here a
naturaleza está
tree
mal
trunk.
sembrada, nos duele cuando la naturaleza
We
no es usada
we suffer
adecuadamente.
when nature is
Pero
not used
aún a
adequately.
pesar de estos
But
troncos
even the
que
bark
parecen
of
ya
these
estar viejos,
trees
no hay
that
nada que
you
hacer
can
porque
consider to
es
be
bueno
old,
para la
they're
salud.
still useful
La
for
guava, el
health.
guam, la
The guava
fertilización
shell,
fundamental para la salud de
extremely
la mujer
important for
después del
women's
parto.
health after
La cáscara
delivery.
de la guayaba es
The
fundamental
guayaba
no
conch
solo para después del parto,
or
sino para
shell,
la
not only after
regeneración
delivery, but also to
en
kill many
con
wounds.
otros minerales y
Gold,
nutrientes
as a
están
mineral
presentes.
from the
El
earth, is
oro lo
very
usamos mucho
important.
para evitar el
We
aborto.
use gold
El
to
oro
prevent
también se usa
abortion. We
mucho
use
para
gold
tomas que se hacen como el
to
agua del mal, que son
to
productos que de
be
otra forma
drink,
los médicos lo conocen como
and it's a
tétano
product
neonatal. Cuando un
that
niño se le está cambiando el
conditions
color,
such
que se
as
vuelve
neonatal
rosadito, que
tetanus
puede morir, que puede quedar
and
con
may die
heridas,
from this
las
condition.
parteras a través de
Midwives
las
through
plantas, de los
gold
juncos, de las
plants
cortezas,
and the
sanan a
barks
nuestros niños de esta
heal
enfermedad.
these children from
Sin
this
embargo, también
condition.
fundamentamos que hay que
However,
suplementar principalmente la
we
vacuna.
should also
Y así
have
es como
vaccines,
queremos
and that is how
compartir
we want
nuestro
to
sistema de salud
coordinate
propio con la
our own
medicina
health system
tradicional.
with
Porque
Western medicine,
ambas
because
medicinas
if
que
both
hemos escuchado
medicines
pueden
hear
ser
each other,
tradicionales,
we can
vienen
see
desde
that
nuestros ancestros.
traditional comes
Y
from
eso
our
es el
ancestors,
pasado,
and that's
pero
the past.
actualmente es
But at
nuestro
present,
presente.
this
Y
is
dicen que
our
el futuro
present.
es la
And
medicina
they say that the
occidental.
future is
Si
Western
ambas se
medicine.
dialogan,
If they
logramos
talk
hacer
between each other,
mucha
we will be able
salud,
to make
paz
a lot of
y
progress, have
armonización
health,
para la
peace,
humanidad
and
después de
harmonization
pasar
for
estos procesos.
humankind and for our
Finalmente.
Afro people.
Y así sucesivamente son muchos
and so on. There many have many components that work on how do we care for health through networks by voice to voice. Prevention is extremely important to generate spaces of coordination, listening to each other, sharing those knowledge, listening in the organization, project management, and so on. Mere fact to be here and being part of this network, of that voice to voice channel, talk about women's health, how midwives in their effort, they manage projects and get updated and technology. Another space extremely important, which is a traditional and cultural approach. This is the component that allows an environment of intimacy with a mother and child pair, and we have breastfeeding accompanying before pregnancy, because midwives is in the entire cycle of the woman's life and of the family life. The midwives are in the territory. That is why we consider to be water, because we provide life. We consider gold because we are in the proximity of the territories and in the remote areas, but there's always someone that can find us because we're valuable and we're useful for health. And there's something very important, which is this topic of how we coordinate, how, next slide, please, how we can achieve one way or another to practice. How do we live by midwives? The midwives generate several actions that they're always taking care of each other, taking care of others and their environment. We take care of rivers, we take care of the elements that the nature provides because we use them for handcrafts. We love the earth and the ground. This is not exploiting mining activity. This is local mining activities. Plants for traditional medicine, agriculture, and that's how the midwife lives and supports herself and takes care of others, taking care of pregnancy. And to conclude, tell you that from our association, we thank you for this space. We thank for the coordination that has allowed us one way or another to listen and to live our experience. Eat and plants, flowers, and animals, and with the nature itself, water, sun, and the earth from Colombia. Thank you so much. Thank you very much, dear Manuela. We reiterate thanks for the excellent presentation. We congratulate you for the certification of deliveries by midwives. There's no doubt, my dear Manuela, accompanying women with words, with warmth during delivery are extremely important, not only for the mother, but also for the child who's arriving at that moment. Hope that you can continue with this effort and for the continuity of coordinating and articulating with the Ministry of Health and Social Protection to recognize the use of our rocks and medicinal plants. Many of them are part of our medicine. We invite you to remain in the room. At the end of the presentation, we will conduct a dialogue based on the questions that are already arriving. Well, now we would like to welcome our Maria Eugenia del Rocío Quiñones Castillo. She was born in Esmeralda, Canton Eloy Alfaro, known as Limones, Ecuador. A technologist in ancestral sciences, doctor in the field of medicine and traditional knowledge of the Afro-Ecuadorian people, national and international lecturer of ancestral wisdom, active participant of the Afro-descendant Congress of the Americas and the Caribbean, Afro-Ecuadorian leader, coordinator of the national and international network of ancestral knowledgers. He is, in addition, is an ambassador of peace for the Kingdom of Morocco, professor of natural therapies of the Higher Institute of Social Studies, Los Andes. She has carried out her activities in the free exercise as ancestral healer in her private practice, Ancestral La Fe, located in Quito, Ecuador. She has participated in national and international meetings, medicine, and ancestral knowledge, represented Ecuador and the Afro-Ecuadorian. Has participated in the Latin American meeting of healers, witches, sorcerers in the Republic of El Salvador, and she is the president of the Association of Ancestral Medicine of Healers, AMAMI. Is a lecturer of ancestral medicine in health centers, schools, and universities. Welcome, dear Maria Eugenia. You have the floor.
Muy buenos días
Good
a todas y
morning
todos.
to
Reciban
everyone
desde el Ecuador
from
mi
Ecuador.
cariño
My
y les doy
warm
gracias por esta
greeting and thank
invitación.
you so much
Muchísimas
for the
gracias
invitation
en nombre de mi
on
pueblo
behalf of my
afroecuatoriano.
Afro-Ecuadorian
También
people.
quiero dar un
I would
profundo
also
saludo
like to
este día
greet
31 de
eh,
agosto, que es
everyone on
Día
this
Internacional
August
de
31st,
los
which is the
Pueblos
International Day
Negros,
of
¿no? Y es muy
Afro
importante
people,
poder
and it is
comentar
very
porque
important
nosotros llevamos
to comment this
nuestros
because
recuerdos, en nuestras
we
almas,
have in
a
our
todos
memories and
aquellos
souls
ancestros
all
que
those
partieron, que se
ancestors
fueron con la
who
esperanza
left
de
us
un
with the
día
hope
poder ver
that
lo
one
que
day
estamos
we
viendo
can see
ahora,
what we
que
see
un
now,
día se pudiera
that one
saber
day
y
we could talk
compartir lo
and
que fue
share
nuestra medicina
our
ancestral y
ancestral
nuestros
medicine
saberes
and our
ancestrales
ancestral
también.
knowledge.
Muchísimas
knowledge.
gracias,
Thank
Gloria.
you
Como
so much,
dijeron, soy
Gloria.
María Eugenia Quiñones
I'm Mario
Castillo,
Eugenia Quiñones
sanadora
Castillo.
ancestral
I'm ancestral
afroecuatoriana. Es
healer
una
from
bendición estar con ustedes.
Afro-Ecuador. It's a blessing to be with you.
Gracias. No
Thank you.
antes felicitándole también
First, I
a
would
mi
like to
compañera
congratulate
Manuela, una
Manuela,
mujer muy sabia
a
del
very
pueblo
wise woman from
afrocolombiano.
the
Bendiciones
Afro-Colombian
para
people.
ella.
Blessings for
Gracias por
her, and
compartirnos
thank
todo
you
su
for
saber
sharing
allá de nuestra
all
gente
your
negra y de
knowledge of
nuestros
the Black
pueblos.
people and of our
Ahora yo
people.
les compartiré a
I
ustedes
would
lo
like to
que es
share
nuestra
with you
medicina
what
ancestral
is
afroecuatoriana
Afro-Ecuadorian
en
ancestral
tiempos de
medicine
pandemia,
in the pandemic
pasado y
and
presente.
present.
Hablándoles a ustedes de la
Speaking
medicina
about
ancestral afroecuatoriana,
Afro-Ecuadorian
¿no?
ancestral
En ella
medicine,
podemos darnos
we can
cuenta cuáles son las
see
técnicas
what are the
aborígenes
Aboriginal techniques
de acuerdo a nuestra
according to
cosmovisión,
our
¿sí? Porque es
vision,
muy diferente
because
de acuerdo a las
different
cosmovisiones
according to
de
the
todos los
visions
pueblos y
of
todas
all
las
the peoples and all
nacionalidades.
the national.
Esta medicina está basada
Medicine
en
is
las
based
prácticas
in
rituales, sanación
practices,
espiritual,
rituals, spiritual
física,
healing,
utilizando todos
using
los
all the
elementos de la
elements
madre
of the
tierra,
Mother Earth,
como plantas,
such as plants,
agua,
water,
aire,
air,
tierra. Esto en cuanto
fire,
a lo
and earth
tangible
in terms of the tangible.
y en
And
cuanto a lo
in terms of
intangible
the
es todo
intangible,
el mundo
is all the
espiritual,
invisible
invisible,
spiritual
como la
world,
sanación
such
con
healing
milagros por
with
medio
miracles
de la
through
salud.
the.
¿Qué les puedo decir?
What can I tell you?
A través de la historia,
Through
a través
history,
de toda la historia
through
de nuestros
all the
pueblos
history of
afro,
our
nosotros venimos
Afro
partiendo
people,
de esta
we've been
cosmovisión,
starting from this
de tal
cosmovision.
cosmovisión que
What
todas las
cosmovision?
enfermedades
That all
tienen cura.
diseases can
Y
be cured.
mirando ahora,
And now
lo reafirmamos
we
que la
can
medicina
reaffirm that
ancestral es la
ancestral
nueva
medicine
esperanza de
is the
vida
new
para la humanidad, dándonos cuenta
hope for
que
life
sin
for
menospreciar nuestra otra
humankind
hermana
without
medicina,
forgetting our
partimos de
sister
que
medicine.
la
We
medicina
know
ancestral
that
tiene su
ancestral
tiempo de
medicine
vida desde el inicio
has
de la
its
humanidad
lifespan from the
y
start
basada en
mankind,
esta
of
medicina.
humankind. And
Yo
based
no
on
supimos,
this
se nos
medicine,
enseña que ha
we've been
sido
taught
nuestra
that
medicina
has been
convencional.
our
Puedo
conventional medicine.
recordarles y puedo decirles
Remind you
con
and tell
experiencias
you
vividas
with experience
por
that I've
qué
lived,
yo seguí
why
lo
did
que es la
I
carrera de
follow
medicina
the
ancestral,
career of
recordando y
ancestral medicine
respetando
by
a mis
remembering and
ancestros.
respecting my
Les
ancestors.
hago un relato muy
I will
rapidito.
make you a brief
A
story.
mis 9 años de edad
When I was
me
9 years
cortó mi
old,
tendón de Aquiles
Achilles
en las
tendon was
travesuras de
severed,
Kenia, donde mis padres me
where my
llevaron después
parents
de 4 días,
took
porque
me
vivíamos en
4 days
el campo,
later
me
because we live in
llevaron
the
donde los
countryside. They took
galenos del
me
pueblo
to the
que
physicians in the
teníamos
town
prácticamente como a
that
24 horas
were
a remo.
24 hours
Entonces
away
el tiempo
by
en verdad
canoe.
había pasado
So the
y cuando
time
llegamos
passed
donde los
by, and when
médicos,
we
ellos
reached
me
to these
atendieron
physicians,
cordialmente y
they took
supieron
care
decirle a
of
mis
me
padres
and
que
they
yo
told my
no tenía
parents that
cura
I didn't
porque mi
have
tendón
any
de
cure
Aquiles ya
because
se
my
había
Achilles tendon
recogido, entonces
had
no había modo
retracted and
porque
there
la
was no way.
tecnología no estaba avanzada como está
Technology was
ahora.
not so
Entonces
advanced
mis
as
amados
it is
padres
now.
me
So my
regresaron al
caring
campo
parents took me back
obedeciendo
to
lo que
the
los médicos me
countryside,
habían dicho
following
que
what the
tenían
physicians
que
had indicated them
mandarme
that they
a
need to
confeccionar, llamémosle
send
así,
me to
dos muletas y a medida
use
que yo
those
fuese
crutches.
creciendo,
And
fuese aumentando
when I
el
grew up,
tamaño de mis
they had to
músculos.
increase the size of
Pero
the crutch.
dentro del pueblo
But
afroecuatoriano
in the
o afro
Afro-Ecuadorian
del mundo
people,
entero, el gran orgullo son sus
the big
hijas.
pride are the
Entonces mi padre
daughters.
y mi madre
So my
dijeron,
father and my mother
mi
said,
hija no se
no,
va a quedar
my
coja.
daughter will
Ellos se
not
fueron
be
al
limping.
campo,
They
tomaron
went to the
raíces, tomaron de todas las
field and
cosas,
took
piedra,
roots
barro, de
and
todo,
rocks and
y
mud,
empezaron a curar
and
mis
they
piernas.
start
Le
curing
digo con tanta verdad
treating
que
my
en
leg.
2 semanas
And 2 weeks
mi tendón de
later,
Aquiles
my
se había
Achilles
unido.
tendon had
Y esta es la mujer que les
joined
está
back
hablando
again.
ahora.
And
No
this
me
is
quedó
telling my
cicatriz,
experience
no
with
quedé
no
coja, no
scars.
quedé
I
válida,
was not
no
limping,
quedé nada de esas cosas.
no
Entonces,
complication
desde ese
whatsoever.
momento
So
yo
from that
dije,
moment, I
hay
told myself,
otra esperanza de
there's
salud,
another
hay
hope for
otra
health,
esperanza de vida y
other
me
life,
incliné a lo que era
hope,
la
and
medicina
I
ancestral
incline towards
que practico en la
medicine that I
actualidad.
practice until
Les puedo compartir que
I
en
would
mis
like to
pueblos
share
no
that in
había
my
antes la
peoples,
medicina
we didn't have
convencional, no había
conventional
medicina
medicine.
convencional, no, la medicina que había era la
The medicine that
medicina
was present
de la
was
de
the
la
medicine
de los pueblos, ¿no?
from the
La
people,
medicina ancestral,
the
lo que
ancestral
había era
medicine.
la
What
partería,
they
lo
had
que
was
habían eran los
midwives
hombres de sabiduría
and the
que
wise
eran se
men
encargaban de
who
sanar
were in charge of
todas las
healing
personas allí
everyone
dentro de
in
el pueblo. Les estoy
town.
hablando de los tiempos pasados, ¿no? Y todos se
The
sanaban.
past,
La
they
persona que
all
no se
healed.
sanaba, no
The
son
person
los
who didn't
sanadores
heal,
o
we,
ellos, los sanadores de estos
the
tiempos,
healers at that
decían
time, would
que ellos
say,
estaban
tell
enfermos,
that they
que
were
les había llegado
ill
tal tipo de enfermedad
because of that
porque
kind
la
of
familia
condition,
debía
because the
sanar
family should
y debía trabajar toda
be
la familia por
aware and
descubrir cuál era la
everyone of the
forma de
family had
sanar
to
ese
discover
problema,
the
cuál
way
era
of
la
healing
forma
that
de
problem,
sanar esa enfermedad,
how to
que era
heal that disease.
aparentemente
That
enfermedad para
apparently
uno,
this
pero a la
disease was
misma
for
vez que
one, but it was
aprendían
also for
todas
everyone to
las
learn
familias.
in the
Imagínense
family.
que es una cosa muy
Imagine that this
importante
is
esto,
something so
y desde
important.
allí se viene
From
aprendiendo
there,
lo que es la
we are
medicina ancestral.
applying
En
ancestral
esos tiempos
medicine.
no teníamos,
That time,
no habían muchos
we
nombres de
didn't have a
enfermedades
lot
como
of
tenemos
names
ahora.
for these
No se
conditions like we
conocían,
have now.
se conocían
We
entre
knew
unos 4,
of
unos 5,
4 or 5
unos 10 de
conditions,
ellos que ya se los voy a explicar.
and I'm going to explain to you.
Entonces, esta
So
partecita la paso porque ya se
this
las
part
estoy
I already
explicando,
explained to
pero
you,
les
but
explico sobre las
I
enfermedades
will
que
talk about
teníamos
the
antes
diseases
en
that we
nuestros
had
pueblos afro,
in our
que
Afro
eran
people,
la
which
enfermedad
was
del ojo, el
disease of
elefante,
eye, the
el
scare,
bicho y el
the
malaria.
bug,
Estas eran las
and the
enfermedades que se
bad air.
conocían
These are
entre
the
ellas
diseases
las
known and the
primeras eran
first three
enfermedades
ones were
espirituales,
spiritual.
¿no? La última, como es
The
la
last
de
one,
los bichos
the
de los que
bugs
estoy hablando, que esas, si
that,
podemos, para entenderle el
in
nombre,
order to
son
understand
los
its name,
escorbutos que se
are
les
the
llama ahora.
scurvy that
Entonces,
we
nuestros
see today.
ancestros en el
So our
momento que una
ancestors at that
persona
time, if
presentaba
the person
un tipo
presented
de enfermedad
any type
estando
of
bien,
disease,
ejemplo, un día
for
amanecía
example, one day
con
they were fine and the
dispnea,
next
con
day
dolor
they
de
woke up
barriga,
sad with
con diarrea
pain,
o
abdominal
cualquier
pain and
síntoma,
diarrhea or any other
enseguida se
issue,
mandaba a llamar
we will
a
call
la sanadora
the
y
healer
ella
to
venía
see
a
them
ver qué le
immediately
pasaba al
to see
muchacho,
what
a la
was going on
muchacha
to that
o
boy,
a
to
la
that girl,
persona adulta.
or to
Ellos
the adult
tomaban,
person.
en este caso, una
In this
cinta
case, they took
y
a
con esa
ribbon,
cinta la
and with that
metían
ribbon, they
al contorno
measured
del
the
pecho.
perimeter of the
Allí ellos
chest,
se daban cuenta si
and
tenía
they
ojo
could
y olfato.
realize if
Si
they had
tenía,
eye
al
or
ir
scare.
la cinta se
And by
movía de punta a
using the
punta
ribbon
y
from extreme
luego
to
al
extreme,
hacer unas
and then
oraciones,
by
unos
doing
rezos
some prayers,
especiales,
special prayers,
se volvía a medir y la
they
cinta
measured
quedaba
it again,
abierta.
and the
Entonces nuestros
ribbon was kept
ancestros
open.
decían,
So our sisters
tiene
will
ojo
say
o
it
tiene
has eye
olfato.
or has scare.
Automáticamente ellos le
They
sanaban
will
con
automatically heal
plantas,
them
con
with plants,
hierbas
with herbs,
y el paciente
and the patient
automáticamente
will
empezaba a
automatically start
recuperarse. Esas eran
better.
las formas, las
That was the
técnicas que
way
nos
and the
mandaban
techniques of
nuestros
how
ancestros
our
para hacer.
ancestors
Y de esa
healed.
manera lo hacían con todo
And
tipo de
they did
enfermedades,
similarly with all type
pegaban
of
huesos,
diseases,
hacían todo. Y
bones,
uno de los
and
mayores
others, because
respetos
one of
que
the
se le daba
greatest respects
a
that
los
they gave
sanadores y
to
sanadoras
the
eran las
healers
parteras,
was
así como mi
midwives.
querida hermana
My dear sister
y compañera que antecedió,
Manuela,
Manuela, que antecedió la
who
palabra.
gave the
Eran
previous presentation.
en las parteras
With the
las
midwives,
que tenían, como
they
quien
were the
dice, el
ones
mayor
that had
poder,
the
el mayor
greatest
compromiso,
power
porque
and
ellas tenían
commitment
ese gran legado
because they had
de
that
atender a
legacy
la madre,
caring
atender
for
al
the
niño
mother
desde los
and the
momentos
child
iniciales, ¿no?
from the
Eso era
initial
muy
moments,
importante
and that
y
was
ellas
very
también
important.
sabían de todo. Ellas
Also
eran las
know about
todólogas.
everything.
Ellas sabían curar,
They
ellas
were
sabían
they
sobar,
need to
ellas
cure, they
sabían
need
también pegar
to
huesos, ellas eran
fix
todólogas,
bones.
¿no? Ya
They did
después fuimos
everything.
como
Then
dividiendo,
we
se
were
fueron
breaking
dividiendo,
up in
la
different
que curaba el
specialties.
ojo y
The
espanto,
one
las
who
que curaban
did eye
oídos,
and
las que
scare,
pegaban los huesos y
the
así
one who took care of
sucesivamente.
the
Pero toda esta riqueza la
bones,
tienen los pueblos afros de todo
richness
el mundo, podría decirle. Donde
of the
hay
Afro
un
people,
negro,
where
hay
there is
un
a black
hombre o
person,
una mujer
there's a man or a
medicina.
woman
Eso
who
es muy importante
knows medicine.
dentro
That is
de
very
nuestros
important
pueblos
to consider
ancestrales.
in our ancestral people.
Entonces, para que tengan
So
recuerdo, recuerden cómo lo
remember
hacían ellos.
how
Con
they
la
did
cira, con
this
esa cinta
with
roja,
that red
hacían
ribbon.
soplados de tragos también,
They also did some spray of
iniciales con
liquids,
huevos. Esto es muy importante, muy necesario
very
y muy
important.
visto
It's
y vivido en todos los pueblos,
seen in
tanto
older
pueblos
peoples,
negros como pueblos
both black
de
and
nuestros hermanos indígenas,
non-black or
donde
indigenous
utilizaban
people
los
who
baños
use
energéticos que eran
energetic
muy
baths
buenos, que
that were
ayudaban
very good,
a
that
dar
help
vida, ayudaban a
give
sobrevivir
life
a
and
una
survive
persona que estaba
to
caída.
someone who had
Utilizaban nuestros
fallen.
ancestros los
Our
que eran
ancestors
los
used
lavados colónicos, ¿no? Eso
colonic
era para
cleansing
limpiar todos nuestros
to
intestinos.
clean our
Y
intestine,
hoy en día también
and
se lo
today
sigue
we
utilizando.
still
Se
use
sigue
it
utilizando porque es parte de los
because this is part
tratamientos de los
of the
pueblos
treatment
afros.
of the
Y les
Afro
puedo
people.
decir que
Tell you
de acuerdo a nuestra
that
cosmovisión,
according to our
nuestros
cosmovision,
ancestros
our
hacían todo, sanaban
ancestors did
todo,
everything. They
aparte de
healed
sanar
everything.
mente, cuerpo y
In addition to
espíritu.
heal
Ellos
mind,
también
body, and
sanaban lo
spirit,
que
they
eran
also healed the territories
los territorios para poder mantener
so they
la
could maintain
biodiversidad sana. No
biodiversity
era así nomás
healthy. It
como
was
se
not
hacía.
just
Y en esos
like
tiempos nosotros
in
no
those times
utilizábamos
we
lo que
didn't
eran
use
insecticidas, no se
pesticides
utilizaba mata
or
mariposa, no. Ellos con su
chemical
inmensa
products.
sabiduría,
With immense
como
wisdom, they knew how
hasta
to do
tenían la
this,
precaución
and they were
de
even
poder
careful to
cuidar
know how to
y
take care
criar a sus
and
hijos,
raise their children.
a sus vástagos, ¿no? Que esto era muy
This
importante.
is very
Sabían
important.
educarlos.
Need how to
Dentro de esto
educate them.
había una
And
gran
in this, they
particularidad que
had
generalmente
vision that they would
los
usually,
sanadores no
where
sabían
the
leer ni
healers
escribir.
didn't know how to
¿Qué les
write,
parece? Ellos no sabían ni
read,
leer y escribir, pero tenían
but
esta gran
they had
sabiduría
this
que nosotros ahora
great
entendemos y llamamos que son
eh,
los dones
characteristics,
espirituales
which are the
que
spiritual
uno
gifts
nace a
that when
servir
you are
en este
born
mundo.
in order to serve in this world.
Ahora, en la actualidad,
Now, at
los
present,
sanadores
healers,
ancestrales
the
seguimos con nuestras
ancestral
prácticas,
healers
con
continue with
nuestras
our
técnicas,
practices, our
utilizando
techniques,
las mismas, pero
using
aplicando
the same
nuevos
ones, but
métodos, ya que
by
en
new
el
method,
transcurso de todos estos
because
años,
in
las
these recent
enfermedades
years,
físicas y
the
mentales
physical
y
and mental
espirituales
diseases and
han
spiritual
aumentado
diseases have
en una
increased
forma
in an
extraordinaria. Si
extraordinary
aplicamos
form
técnicas
that we
básicas,
apply
no
basic
podríamos
techniques, we
sanar
won't be able to heal them.
sanarlas. Y es por eso que
That
aplicamos
is why
técnicas
we
como el buen
use
vivir.
techniques such as good living.
El buen vivir de
Good
nuestros
living
pueblos
of our
estaba
people
en esa armonía perfecta,
was in that
en
perfect
ese
harmony,
saber saludar,
that
en ese
know how
saber
to
estar
greet
pendiente y
and be
presente
alert
de
and
lo que le
present
pasaba a
of
nuestro
what's
vecino.
happening to our
En todo
neighbor.
eso estaba ese buen vivir de
We have this
nosotros,
good
de
living
nuestro
that we
pueblo afro,
practice our Afro
ecuatoriano y
people
que
in
ahora
Ecuadorian
nosotros
people
sabemos compartir, que el
know how
compartir
to
también es
share, and that
medicina,
sharing is
¿no?
also
El
medicine.
compartir es una conexión
Sharing is
espiritual
also
que
a
permite
spiritual
la
connection
felicidad de
that
los
allows
pueblos, que
happiness
permite
to
la
occur in the
tranquilidad
people.
de los pueblos. Y esto
And
era
this
parte del diario
part
vivir
of
de nuestra
daily
gente,
living of
como
our
es
people.
ahora. Allá
We
en
have it
nuestros
now
pueblos,
in our
cuando
peoples
una
over
persona
there. When
no es feliz,
somebody
no es
not
feliz
happy,
ninguno.
no one.
Entonces allí aplicamos
So
esa palabra
there we
maravillosa,
use this wonderful
Ubuntu.
word,
Soy
Ubuntu.
porque eres.
I'm
Tengo
because you
porque
are.
tú
I have
tienes.
because you
Soy
have.
feliz porque tú
Be
eres
because you
feliz.
are
Y
happy.
eso es muy
And
importante
that's very
en los
important.
pueblos, en nuestros pueblos, eh,
That's very
cuando
important for our
viven cosas
Afro
tan
people
básicas que a
with
nosotros
basic
nos
things
hacen vivir,
that
cosas
makes us
básicas que a nosotros nos dan
live
medicina,
and gives us
cosas básicas que a
medicines,
nosotros nos
basic things
hacen
that
sentir y
make
ser lo que
heal
somos.
and be what
No lo,
we are.
no lo podemos olvidar
And we
porque eso es la
cannot forget
herencia
this
de
because
nuestros
this is
padres.
heritage
Cada
of
uno de
our
nuestros padres nos
parents.
enseña
Each one
el
of our
buen
parents taught
comportarse,
us
el buen
to
saludar,
behave,
el no
how to
robar,
greet,
¿no?
not to steal,
El no ser ocioso, el pensar
to
bien.
think.
Todo eso nos enseñan ellos y nosotros
Everything
lo vamos
is taught by them,
compartiendo de
and we share
generación
it from generation
en generación.
to generation.
Puedo también a ustedes compartirles
I would also
que
like to
dentro
share
de
with
nuestros
you that
pueblos
in our
afros
peoples,
mundiales
in the world Afro
hay
people,
un gran,
there
se les da un gran culto a nuestros
we
ancestros,
follow
se les
and
da un gran
have a
respeto
lot
a
of
nuestros
respect to our
ancianos,
ancestors,
hasta el
the
punto de
elderly,
que
to the
en
point
nuestros pueblos
that
no hay
in
asilos
our
de
peoples we
ancianos,
don't have
no
nursery
hay ese
homes.
tipo de cosas.
We don't have that type of
Nosotros
things
estamos
because
con nuestros abuelitos
we have
siempre
we are always with our
en el buen vivir y
grandparents,
también
and
en
in
el
good
buen
living
sentir.
and the
Le
good
rendimos
dying.
cultos a nuestros
We
ancestros hasta
respect our
después
ancestors
de
even
muertos.
after
Estamos con
they
ellos
have died,
todos los días de la vida.
and we spend all
Nosotros
of
no hacemos
the days of our lives with
a
them.
nuestros mayorcitos, no los ponemos
We don't send
en una
our elderly
habitación
in a
separada.
room
No,
alone.
nuestros mayorcitos son parte de
Elderly
nosotros.
are part of
Nosotros
us.
no hacemos nada
We don't
sin
do
pedirles a
anything
ellos
without
el
asking them
consentimiento,
for
sin
their
pedirles
consent
a ellos la
or asking
sabiduría.
them
Esto
their
es muy importante en el pueblo afro
knowledge. This is
ecuatoriano y
very
esto es
important in the Afro-Ecuadorian
muy
people.
bueno
That
resaltarlo
is
para que el
also
mundo
important to
conozca
highlight
quiénes
so the
somos
world can
nosotros
know
los negros. Somos
who we
gentes
are, the
buenas,
black people. We're
somos
good
gentes
people.
nobles,
We're
somos gentes
nobles.
trabajadoras.
We
No somos
work
como
hard.
dicen que somos
We're
vagos,
not
no.
like they
Esa
say that we
palabra
are
vago
lazy.
nació en el tiempo de la
That word
esclavitud.
lazy
Decían
was
vago
born during
para que
slavery.
trabajen más, para que las personas
lazy so they can work more. I'm making all my effort. And why do they call me lazy or bum? So they try to give more than they had at their hand. But it's not only that people. We have good soul. We're people who are altruistic. We are not happy if we don't see happiness in the others. Sincerely, that is truth. And now I can share with you something more coming to the end of my presentation. In Ecuador, we see an ancestral medical center called the Faith or La Fe. We do wonderful things, healing that are almost people that are hopeless and have been discarded by science because, and this is because we, in addition to reach the patient, we don't come with the healing of the symptom. We look for the origin of the disease, what caused that problem. That is usually a family problem or issue because we have realized that when a person in a family is ill, it's not just that person who's ill, it's the family also. The family at large are ill. So the ancestral medicine can heal all type of diseases because this is a spiritual, and when the patient wants to heal, they'll do it because put all his or her faith and conviction that they're going to be healed. So ancestral medicine, in addition to be based on the elements in plant and water, is also based on that large faith, that level of spirituality, at that level where we let God do his work, where he makes the work that he has to do. So this is so important for our people, communities. In this part, I'm always participating in seminars and showing that my country, Ecuador, and to the authorities have given a lot of importance and value to ancestral medicine. I feel happy and proud now of what my country is because governments are integrating ancestral medicine to conventional medicine and to integrative medicine, and that is so important. What we want now is that the governments, not only from Ecuador, but the governments around the world, the global level, will integrate ancestral medicines to their hospitals and health facilities, schools, and to all these places and spaces where the patient who decides with what method they're going to be treated. We're going to ask God that this happens this way for the well-being of of humankind. Thank you very much for listening. Thank you very much. I hope that made a contribution. Thank you. Ubuntu. Thank you so much, Maria Eugenia, for this presentation, this call to reflection, to and coordinated effort. There's no doubt that both the natural elements and respect to the other person, but above all, the faith are part of traditional medicine, and why not of general medicine, of current Western medicine, and also with the cosmovision of the ethnic populations. If we have to learn something from them, it's their faith. Hope that traditional medicine makes more progress for Afro-descendant so we can coordinate, as you have pointed out, with the current health systems in the Andean region. Thank you so much, Maria Eugenia, for your presentation and your call to think more about that. Thank you so much. Now, we will continue by giving a warm welcome to Dr. Mar Mario Izquierdo. He graduated as Doctor of Medicine at the Latin American School of Medicine in Havana, Cuba, and specialist in family and community health at the University of Medical Science Carlos J. Finlay in the city of Camagüey, Cuba. A specialist in public health at the Universidad José Sánchez Carrión, and he graduated from the master's degree in primary healthcare at the Cayetano Heredia Peruvian University. He has developed studies of health technology assessment with the Andean Health Organization, a Polytechnic agreement, and in management of health indicators at the Institute of Quality for the Pontifical Catholic University of Peru. He has also developed studies of interpretation of statistical results in scientific research at the Harvard School of Public Health. He has been Deputy Director of the General Office of Strategic Interventions in Public Health of the Ministry of Health and Executive Director of the Office of Life Course Interventions and Comprehensive Care of the Ministry of Health in Peru. Y Dr. Izquierdo is the health coordinator of the Afro-Peruvian Working Group of the Congress of our Republic, member of the Center for Research in Primary Healthcare, CINAP, of the Peruvian University, Cayetano Heredia, and associate member of the Peruvian Society of Family and Community Medicine. Go ahead, Dr. Izquierdo, you have the floor. Welcome. Thank you, dear Gloria. Greetings, and through you, greetings to our dear Executive Secretary of the Andean Health Organization. We are honored to be part of this space that Orasconu generates with this approach, as Dr. Calle indicated in her introduction, with this interculturality approach and holistic look to all the plots and all the ethnies for Latin America and the countries who are members of this Orasconu. It is important to highlight that today, precisely as Lady Margenia mentioned, in terms of health, of the International Afro-descendant Day, to extend my greetings to all the Afro-descendants. Couldn't be a better moment to have this presentation that I'm going to start to share after listening the excellent presentation of Lady as well as Maria Eugenia, because they have put on the table a context that is key in coordination and continuity to look at the Afro-descendant health situation. We cannot talk about, talk today about the health in Afro-descendant population in the case of us as Peru, without looking to all the aspects that they have presented in terms of ancestral knowledge and in terms of the intercultural approach that should be present always in current medicine. Having said this, I would like to show how we're doing in terms of Afro-Peruvian population and what are the challenges for the health sector. It is key that we need to look all the previous history and background to locate us in the current context. It is not easy to look at in Peru with Afro-Peruvian health, where we have as culture and as a country that is in majority of Andean population and some Amazon population. The Afro-descendant population is around 14%, but at some point to consider some aspects of health. First of all, I declare no disclosure for this presentation because I'm Afro-descendant. I wouldn't like to express any bias in terms of information. I would like to be objective, following the data that we see with the data collected from several institutions, including the research that we done from our primary healthcare research center at Cayetano Heredia University. Today, we are in a world of rapid transition. It's important to highlight why. Because when we talk about these rapid transitions, we talk precisely of the overlapping of some elements from ancestry with current aspects, both in climate transitions, demographic transitions, epidemiological transitions, how some diseases, quote unquote, of the old ages, but are still present and are present with us in this technological transition, social, and even economic transitions. The use of technology nowadays goes hand to hand with everything we do, not only in terms of health, but other aspects of working with the population. That is why, thanks to technology, today we can see in this important space. Today, the concept of health has been expanded to well-being. And the concept of well-being looks for not only multi-sectorial with multi-sectorial actions and empowerment of people and communities, but also with the recovery of primary care and to break that look of primary care as just the first level of care in health systems, with a look of primary care, but rescuing this triangulation with empowering of the people and communities, which requires the recognition of their knowledges and their idiosyncrasies. That is why we are person-centered model, where here we have the case of Juana, and I thank you for letting us share her picture for this presentation. With Juana, it's an elderly 70-year-old Afro-descendant that comes to a health uh, facility with a history of hypertension, dyslipidemia. She also has glaucoma, some onychomycosis, and she has a history of a sister who died from breast cancer. But together with these conditions that she comes to a health facility, she's a mother and grandmother. She lives in the south part of Lima. She retired teacher. She likes to take care of her hair, play volleyball, and she lives with one of her children and her husband. And she's facing challenges of how to learn to get old and the economic difficulties, and also dealing with insecurity. And she likes to see the same physician that's taking care of her. So we need to look at Juana in a holistic manner and look at her expectations in her cosmovision should be the way how we recover these health services with an approach of this person-centered care. And here we have some challenges with terms of Afro-Peruvian population. 4 out of 10 has some kind of chronic disease, and 1 out of 4 has high blood pressure. These are data from a study specialized for Afro-Peruvian population made by Grade some years ago, and we haven't done any recent information in terms of data related to prevalent diseases in the population.
El uso de servicios, el Centro de
In terms of
Desarrollo
the service use, the Ethnic Development Center showed us in 2013 that 52% of children from Afro-descendants have some difficulty with their sight. So they had the need to use some kind of glasses. 57.9% of Afro-Peruvian children did not go to a health facility when they were ill, especially adolescents. So the lack of trust of coming to health facility that will allow them to take care for first with an holistic approach, doing the biosocially in with an intercultural approach, respecting their ancestral knowledge transferred or is being transferred by their parents or caretakers, as well as did not suffer any type of discrimination. That is why children reported that didn't go to health facilities because this perception of discrimination. It was a common practice not being called person, but being called the color of your skin, or black or the little black child, elements that become normal in terms of stigmatization and that hide this discrimination. So it is important to highlight because this is some data that's seen in national studies. According to this specialized study for Afro-Peruvian population, reported 25.6% of the heads of homes suffer hypertension. So 1/4 of the household heads with Afro-Peruvian descent had this condition. 41%, almost more than 1/3 of the population from Afro-Peruvian that was studied here had some kind of chronic condition, such as dyslipidemia, diabetes, cholesterol, triglyceride, and some heart condition. The Afro-Peruvian women present the more prevalence of these conditions more than males. The highest incidence of disease is found in Lima, because we have large pockets of Afro-descendants that live in the capital city in some specific districts, such as downtown Lima, Barranco, Chorrillos, or San Martín de Porres, and some districts where we have a concentration of Afro-descendants in the coast urban areas, in the south, more in the north, the Ica region with Chincha, the district of Tambo de Mora, Sunampe, which are districts where there's a high prevalence or predominance of Afro-descendants. Use of contraception, only half of the population, more frequent in the north and in rural areas. And the traditional health practices, most of them, more than 70%, use these additional practices as part of their actions in health, using the passing of the egg or the use of herbs or prayers, because this shows the need to add this, the addition of these ancestral practices. And these are aspects that are trivialized or are not identified with a population that is predominantly Andean or Amazonic, where we talk about intercultural medicine or traditional medicine and ancestral knowledge, but based on that adherence that we as country have had, but neglecting these practices that are also part Peruvian culture. So when we look at this situation of the traditional towards contemporaneous and in the world of transition that I have pointed out, the United Nations Organization with Resolution 68-237 declared the international 10-year period for Afro-descendants, with the topic of Afro-descendant recognition, justice, and development, trying to recover from many of the mistakes of the past, where the Afro-descendant population was brought. They didn't arrive here. They were brought here, and something that we need to correct. When they said they arrived, no, they didn't arrive. They were brought as slaves in vessels from Spain and from Portugal to work in the to replace the workers from the Andes, not only for forced labor, but also for the extraction of mineral. So trying to make some repair, this made this recognition, justice and development. To talk about recognition is to revalue, historical revalue. As Afro-descendant population, you are part of the process of development of nations, both in the colony time as well as in the republic and the contemporaneous. Justice because we look for equity, so everyone receive what they need to reach their development, and the development itself that involves to generate conditions. So in terms of health, they go to Resolution 69-16, where they propose this program of activities for this 10-year period, and we specifically deals with the actions that the states need to work on in order to comply with this recognition, justice, and development. And in terms of health specifically, it urges item 24 into the same, the state should adopt measures to improve access of Afro-descendant to quality health services. And 27, the state should incorporate a gender perspective in oversight and formulation of public policies, considering the needs and specific needs and realities of women and girls of African descent and the sexual health and reproductive health. It highlights that health services and sexual and reproductive rights as established lines of health. And this gives an intercultural agenda in terms of health and had the goal to evaluate the role that the state has been uh, doing, as well as the organized civil society and all the stakeholders that work, Afro-Peruvian financial institutions who put the resources to guarantee the compliance with this access in terms of quality health services, as well as reproductive and sexual rights. The international organizations are the ones that will contribute to the country in the progress that they made with regards to the implementation of these actions for the 10-year period with these multilateral institutions in the private sector with regards to the implementation of action plans and specific policies in terms of health, but with the goal of achieving a real interculturality, not only in paper, because it's easy to have a 10-year period for Afro-descendant and to have the web page of this 10-year period very rich and flashy, but in terms of subject and substance, there's nothing being done. For that, the state, through the national plan approved by Supreme Decree in 2016, tries to, and I'm saying it tries to draft the first actions for the Afro-Peruvian population as an approach from the state and multi-sectorial, but it attempts, because unfortunately, this development plan was suppressed in 2019. And about this, the ombudsman in Peru was quite emphatic in expressing their concern of the poor progress made in terms of the implementation of this development plan. In addition, a development plan with no budget doesn't guarantee any rights and compliance. Now we have a new attempt. Supreme Decree 005, recently approved, that talks about a national plan, but talks about a national policy for Afro-Peruvian people to 2030. Why 2030? Because it wants to match with the 2030 agenda of the SDGs. A policy that also I consider that is still growing in terms of multi-sectorial coordination, where the organized civil society should have a key role in terms of being vigilant if they're clients. There's some aspects that we still see quite weak to walk towards a real intercultural agenda in terms of health. And also we need to consider diversity, cultural hegemony, idiosyncratic and of beliefs. The definition of the concept of culture is key because in our country, as in many other countries of Latin America, in the Andean region, they propose overlap of several aspects. That's why the self-identification is key, and that has to do with the concept of culture. How do we talk about groups respecting that idiosyncrasy and beliefs? Social hierarchies that you think that you're different or better than from the other because of your social position, and this is also part of the intercultural agenda, and also the integrating and integrationist policies. We need to differentiate it, how we can have all the stakeholders horizontally, the approach of person-centered health. So on the basis of this intercultural agenda, what is the current situation? The epidemiological indicators related to health of the Afro-descendant populations are quite poor conditions due to the presence of chronic diseases in higher incidence than the rest of the population. That is collected for surveys and not records registries, because the 066 registration code for ethnic in the Afro-descendant population, but not only in terms of identifying objectives when the doctor see a patient who phenotypically is Afro-descendant and I have to place 0.56. But what I mean is those who their traces may not be fully identified, and this person can self-identify. Self-identify requires we ask the person, and sometimes the health provider doesn't consider this question and put the code of mestizo that makes invisible the generation of data related to the Afro-descendant population that is seen in a territory. This was evident when we the information of the what we were doing, and I will discuss to you later because the health facilities didn't have a list of Afro-descendant population that we could use. They could express the voluntary because we should have to start looking at people who the doctor knew the people and they know that this person was Afro-descendant. So they generate a sort of empiric approach, collecting information, but we didn't have disaggregated data because this registry code made it difficult. And also the absence of recognition of ancestral and own medicinal practices. The situation on the basis of this intercultural agenda proposes some challenges, things that should have been done, and is also proposing at the national level to have an agenda to what this 10-year period proposes, but however, this is the current situation. There are challenges to this intercultural approach to care in the long term, to go away from the reactive individual care where we only see one that comes because they have a disease, where there is no coordinated care between first level, second and third level services with a level of a first contact and respecting interculturality, and also without guaranteeing any trust because of the lack of respect to intercultural aspects, going towards an improvement in the population's health conditions sustained in all segments with equity and, and significant sanitary results, and considering all these elements of the culture itself. So there is a challenge. The idea is to go away from this intersection point towards allowed us to see this improvement in the population health status, but it's still a process that's quite slow in order to get there. So there was a need to generate data, generate information of how we're doing. And for that, from this research center, together with some resources by the Concitec and ProScience, we collected the perception of compliance of the primary care attributes and cultural pertinence for public services in health for the Afro-Peruvian population. We wanted to learn how the Afro-descendants are taken care of in the health system, and if there was compliance for the attributes of healthcare from access to the guarantee of a physician that could be trusted, that will guarantee the longitudinal follow-up throughout the course of their life. In addition, cultural pertinence was present or not, and this supposes the respect both to certain ancestral knowledge as well as assertive communication by the professional. The Ministry of Health in Peru has a document that talks about certification of competences, intercultural competences for health facilities. But when we review the type of survey that they use and the items that should be guaranteed in terms of intercultural approach, these are prioritarily more for the Andean and Amazon culture, and have tried to extrapolate to Afro-descendant culture, which is not correct. We think that the instrument should be once again reviewed and validated with pertinence for Afro-descendant population. The outcomes or results, this analysis considered interpretation of responses provided by the people that were interviewed in terms of some characteristics, allowing to pool general characteristics in the use of primary healthcare perception regards care and experience at least in the primary healthcare services about care and other related elements of how they treat them and the relationship with professionals that offer the services, the differentiated and discrimination, differentiate treatment due to socioeconomic factors, because much of the Afro-descendant population in certain areas lives in terms of poverty and adverse socioeconomic situation, and also discriminatory practice due to ethnic or cultural factors, where these elements are invalidated, that they must practices. Differentiated treatment based on the existence of links between the user and health provider, people that prefer to take some discriminatory practice in order to receive some care, because if I can generate any resistance, that will create a inadequate treatment by the health professional, or this element of domination, because I provide health, I don't take care of you, or I leave you for the end. So people have to avoid any confrontation, and also the perceptions of the representation of Afro-Peruvian population. So in order to conclude, health as a condition and construction is related to the right of the person, regardless of the ethnic group that they belong to. This leads us that the needs of health in the Afro-descendant population have not been considered as the needs of a group that's culturally diverse with their own cosmovision and idiosyncsy. Moreover, when we see the Afro-descendant population in Peru, mostly located in urban areas, there's a dilution of the possibility of this plural and diverse look. We require more studies that will update the prevalence of diseases, cultural pertinence for their care, because it's not just the disease and treatment that may be transversal to all ethnic groups or cross-sectional to all ethnic groups. And this is, we need more evidence because we don't have data generated in recent years about this disease. Also, the perception that they have of health system, among others. The approach of social determinants from all the stakeholders from the state should allow to improve living conditions of the Afro-descendant population. I mentioned they're mostly located in urban areas, but with adverse socioeconomic conditions. And something that is of our great concern, and at some point we would love that the Animal Health Organization could have a dialogue working group with all the stakeholders from the Andean countries to look at the relation to the 10-year international period for Afro-descendants that is almost over, that is going to expire in 2024. There are very few progress made in relation to health. And now, because we're talking about health, but perhaps there are many low progress with other spheres that this 10-year period proposed for countries in terms of fulfilling justice, recognition, and development. Thank you very much for your attention. Thank you for the invitation on behalf of the working group of the Congress of Thank you, Mario. We thank you for your excellent presentation. There's no doubt that we require a center focus, a person-centered health approach. See the people in a comprehensive, holistic way. We require to strengthen the cultural approach in the health services, will allow access to good quality health services, considering the needs, in this case, of the Afro-descendant population in first place, the recognition of the ancestral knowledge without forgetting them. This access to health services requires trained health teams that have as part of them people from the different population groups that we have in the Andean countries. And if they don't have them, we require health teams that know about, learn about the cultures of the population. What you don't know, you don't respect. What you don't know, you don't work on. Do you don't care for it? So We need to know the other cultures, and our health teams should be strengthened to talk about a real intercultural effort. Well,
Necesitamos que todo esto se dé en el marco del ejercicio
all of
pleno
this has to be done under the frame of the rights of health of all of our populations, as you have mentioned, and both Maria Eugenia and Manuela have. Now from our SCONU, our commitment to continue with this effort and the Intercultural Andean Committee, the Andean Subcommittee of Health for us. Well, my dear speakers, I'm going to a small active pause that we offer to all our speakers and all the people who from the audience, because it's always good to make a small pause for our physical health, mental health. Go ahead, Rob. There will be no interpretation on this active pause.
Buenos días, buenas tardes. Desde el Organismo Andino de Salud, Convenio Hipólito Unanue, estamos muy felices de invitarlos a esta actividad saludable. Hoy vamos a trabajar la agilidad, la velocidad. Así que quiero que repitas junto a mí. ¿Listo? Muéstrame tus dos manos al frente. Perfecto. Cuando las tengas, repítalo y dígalo en voz alta. Manos arriba. No te escuché, dígalo. Arriba. Eso. Abajo. Izquierda. Derecha. Al frente, atrás, arriba, abajo, izquierda, derecha, atrás, al frente. Perfecto, lo tienes. Llegó el momento de la agilidad, la coordinación y la velocidad. El movimiento que yo diga, tú haces el movimiento contrario y lo dices en voz alta, ¿listo? Entonces si te digo arriba, ¿tú qué dices? Abajo. Abajo, perfecto. Izquierda, ¿qué sigue? Derecha. Perfecto, al frente, atrás, al frente, abajo, izquierda, domínalo, derecha, el que se equivoque gasta un refrigerio para todos, ¿listo? Bueno, fuimos arriba, abajo, izquierda, derecha, al frente, atrás, paso a la izquierda. ¿Para dónde vas? Para la derecha, ¿sí o no? Paso a la derecha, perfecto, paso al frente. ¿Para dónde vas? Paso atrás. Arriba, velocidad, abajo, izquierda, derecha, paso a la izquierda, paso a la derecha, paso a la derecha, paso a la izquierda, paso atrás, ¿dónde estás? Paso adelante, perfecto, paso a la izquierda, perfecto, paso a la derecha. Oh, porque mi misión es confundirlo, mi misión es confundirlo y que tú estés coordinado, ágil, veloz, excelente. ¿Cómo está la gente de Bolivia, de Chile, de Colombia, de Ecuador, de Perú y Venezuela? Necesitamos los más ágiles del Horas Cono, ¿listo? Entonces, manos, arriba, ¿para dónde vas? Al contrario, ¿no? Arriba, abajo, izquierda, derecha, paso a la izquierda, paso a la derecha, paso al frente, paso atrás. ¿Qué tal si te digo brazo derecho? ¿Cuál subiste? ¿El izquierdo? Ah, bueno, brazo izquierdo, perfecto, codo izquierdo. ¿Dónde vas? ¿Dónde vas? Codo derecho. Paso atrás. ¿Para dónde vas? Paso al frente. Paso a la izquierda. Paso a la derecha. Atrás. Adelante. Arriba. ¿Dónde estás? Abajo. Ojo. Giro a la izquierda. Giro a la izquierda. ¿Por dónde giraste? Ah, perfecto. Giro a la derecha. ¿Para dónde giraste? ¿Para dónde giraste? Ojo porque mi misión es confundirlo. Lo tienes. Brazos, brazos, brazos. Arriba, ¿para dónde vas? Vas para abajo, ¿no? Al contrario, abajo, perfecto, ojo, izquierda, derecha, brazos al frente, abajo, muy bien, izquierda, izquierda, eso es, derecha, abajo, paso adelante, ¿para dónde fuiste? Ay, no se deje confundir, paso atrás, paso adelante, paso atrás, eso, dilo en voz alto, brazos, brazos, derecho, izquierdo, brazo derecho, brazo izquierdo, ojo, rodilla derecha, ¿cuál tocaste? Rodilla izquierda, giro a la derecha, perfecto, giro a la izquierda, perfecto, lo tienes, adelante, venga para adelante, ¿para dónde se fue? Para atrás, ¿sí o no? Paso atrás, Perfecto. Derecha, derecha, derecha. Ahí, izquierda, abajo, arriba, paso adelante, paso atrás. No se deje confundir porque usted debe hacer los movimientos contrarios. ¿Listo? Última oportunidad. Velocidad, agilidad. Recuerda que lo que yo diga, tú haces el movimiento contrario y lo dices en voz alta. ¿Listo? Ánimo, organismo andino de salud. Yo creo en ustedes, los valientes, los fuertes, los guerreros, las guerreras, todo. ¿Listo? Manos, ojo. Arriba. ¿Para dónde vas? Eso es. Abajo. Muy bien. Derecha, derecha. Muy bien. Izquierda. Al frente. Atrás. Paso adelante. ¿Para dónde vas? Ahí. Paso atrás. Paso al frente. Paso atrás. Giro izquierdo. Giro izquierdo. ¿Para dónde vas? Giro derecho. Perfecto. Brazo derecho arriba. ¿Cuál subiste? Brazo izquierdo. Al frente. Rodilla derecha. Codo izquierdo. Oreja izquierda. Oreja derecha. Ay, no se deje confundir que el profe le pone trampitas. Último, arriba. Tú vas para abajo, ¿sí o no? Abajo. Muy bien. Izquierda, izquierda, izquierda. Derecha. Paso al frente. Paso atrás. Giro izquierdo. Muy bien. Giro derecho. Ojo, pierna derecha. Ahí sí es la derecha. Ojo, ahí, domínelo. Pierna izquierda. Ahí, la contraria, si es la derecha. Giro izquierdo. Muy bien. Brazos arriba. Brazos abajo. Perfecto. Izquierda. Derecha, al frente, atrás y te das un fuerte aplauso. Muy bien, ¿cómo te fue? Coordinados, coordinados, veloces, ágiles y demás. Bueno, recuerda que estas pausas activas son momentos de recuperación físicos, mentales, emocionales para favorecer un estilo de vida saludable. Desde el Como estamos muy felices de que desarrollen estas actividades con nosotros y los motivamos a seguir llevando un estilo de vida saludable. Nos vemos pronto. Chao, chao.
Agradecemos a nuestro coach en
We thank
pausa
our dear
activa,
coach
que
for this
semana
active
a
course
semana tras
that
semana
week after
nos
week
comparte ese ejercicio.
is sharing with us
Motivamos
these
y llamamos a todos los que
activities,
nos acompañan a
and
darse el
we
tiempecito
will
para
ask you
poder
to take some time
realizar estas
to
actividades
do
que
carry out
siempre
these
nos hacen
activities
bien.
that are always so
Entonces
useful.
ahora queremos saludar
And
a
now
todos
we
los que
would
nos
like to greet
acompañan,
all those
especialmente a los
who are
funcionarios
with
de
us,
la
especially the officials
salud,
of the Ministry of
de
Health,
academias,
of the
organizaciones sociales,
academy, social
instituciones
organizations, and public
privadas
and private
de
institutions
Argentina,
of
Belice,
Argentina,
Bolivia,
Belize, Bolivia,
Chile,
Brazil, Chile,
Colombia,
Colombia,
Ecuador,
Cuba,
España,
Ecuador,
Estados
Spain,
Unidos,
USA,
Guatemala,
Guatemala,
Inglaterra, México,
England,
Nicaragua,
Mexico,
Paraguay,
Nicaragua, Paraguay,
Panamá,
Panama,
Perú,
Peru,
Uruguay y
Uruguay,
Venezuela.
and
Hemos
Venezuela.
recibido muchos
We have
saludos y
received many
felicitaciones
greetings and
para
congratulations
nuestros expositores.
for our
Muchas
speakers.
gracias.
Thank you very much.
Ahora, para iniciar este diálogo, yo les
Now to
agradezco a mis
start
queridos
the
expositores
dialogue,
que aquí mantienen
I
sus
ask
cámaras
my dear
encendidas
speakers to please
y
turn on your
vamos a
cameras,
pasar a
and we
las
will move on
preguntas que nos
to
han
the
enviado.
questions that have been sent.
Entonces,
So,
estamos en este momento,
at this moment,
voy a comenzar con la
I'm going to
primera
start with
pregunta.
the first question.
A ver, estamos con las cámaras encendidas, ¿verdad todos? Sí.
We all have
Ok, entonces
camera
ahora
videos active. So let's go on.
voy a hacerlas en general. Ustedes, por
These are
favor,
going
me
to be
dicen quién
general
va a responder.
questions, and you
¿Cuáles
decide
son
who
las
wants to
principales
respond it. What
expresiones
are
de
the most important
discriminación
expressions of
dentro de
discrimination
las interrelaciones
in
sociales en
these
sus
social
países?
interrelations in your
¿Cómo ha
country?
cambiado en las últimas
How
décadas?
they
En el
have
caso
changed
que
in
usted
recent
cree que haya
decades
cambiado.
in cases
¿Y qué
if
normas
you consider that they have changed,
consideran más
and what
relevantes
regulations do you think are
o
more relevant
urgentes en esta
in this
parte?
or are
¿Alguna pregunta?
urgent in this regard?
Adelante, por favor.
Quisiera darle pase de repente a las damas que quieran
Perhaps ladies first.
para poder pues, complementar algo. Su micrófono, María Eugenia.
Le decía, doctor, siga.
Yes, no, go ahead. Yes, please, we will follow you.
De manera muy puntual, destacar tres aspectos
I would like to highlight three
que
aspects that are key that have been
en nuestro
that
país.
we are seeing in our country.
La tendencia al
The trend towards
solapamiento de aspectos discriminatorios en
of
materia de atención
hiding some
por
discrimination actions changing into stigmatization.
hacíamos el recojo de la información.
When we were collecting information from the people,
A las personas de una
the
determinada
fact
fila
that a
que
person
tenían
from
cierta
one line
identificación,
that go into a
decían
health
señora
facility
y al afrodescendiente
say
pues
Mr. or
necesariamente
Mrs.
o
and
negro,
I call the
no podíamos
Afro-descendant
tratarlo de
black.
igual manera que a las otras
We
personas.
don't treat them similar to the other
De
people,
interés, ¿no? De
but it's
cariño, no lo
because we
tomes a mal,
care for them.
de
Don't take it
cariño,
bad.
que no lo tomes a mal, ¿no? O sea,
We're
trivializando,
just being trying to be
la
nice, so
forma
they
de
trivialize
expresarse hacia
how
la
they
persona
express
afrodescendiente,
towards
¿no?
the
Entonces,
Afro-descendant.
estos pequeños aspectos de
This small
estigmatización
aspect of
han normalizado,
stigmatization
han
has
normatizado
became normal,
una forma de comunicación
a
con las
way
personas.
of
Entonces,
communicating with them. So
eso por un lado. Por otro
that
lado,
on one hand. On the other hand,
algunos profesionales,
the fact that
especialmente
some health
los que prestan
professionals,
servicios,
the
miran a
services,
la persona
would look at the
y
person,
por ser afrodescendiente,
and
vamos a
because they are
decir o señalar
Afro-descendant,
de que él no atendía a
one
las
could point out
personas,
that they
¿no? Él no
didn't
atendía, fue uno
take
de
care
los elementos
of
que se recogió
Afro-descendants.
en uno de los grupos de
That
población
was
allá en el
collected in
norte,
one
¿no?
of
Entonces,
the
por eso
population
decía,
groups in the
él no
north part of the
atendía
country.
a población afrodescendiente porque
He didn't take
no
care of
manejaba algunas
Afro-descendant
dolencias, algunas
because
enfermedades
he couldn't
lo
handle
cual
some
me
diseases
parecía
that they
muy
were present.
descabellado una expresión de este tipo,
And
¿no?
we
Muy
thought that that was
descabellado,
quite off the wall. It could be an isolated cases, but
ha ocurrido, ¿no? Y
it
eso
has occurred.
ha llevado
And
a
these have led
elementos en los que se ha
us to
empezado a
elements where we
normalizar,
made some progress,
en materia
significant
legal,
progress
donde
in
hoy
legal
las prácticas
terms
discriminatorias, no
where
solo en Perú, sino en
discriminatory
otros lugares,
practice, not only for
Argentina, Brasil,
Afro-Peruvians, Afro-descendants, but
han
also Amazon
iniciado
or Andes, or
limitación
due
posterior
to
que pudiera
some
llegar a poder ser sancionadas incluso hasta con pena de cárcel,
physical
hay
limitations could be
reparaciones civiles que
penalized
existen aquí por algún elemento relacionado a discriminación.
because of some
Entonces,
element
eso es
related
una
to
cuestión
discrimination, not only
muy
for
apropiada,
Afro-descendant, but
pero
any
es
type of
importante
discrimination,
porque es un avance,
which is
porque
significant because that's
debería
a
de contribuir a
progress made
retroceder
and should
en la
contribute
estigmatización que señalaba al inicio.
back in
Ahí me
that
quedo en esta parte.
stigmatization that I mentioned at the beginning.
Muchísimas gracias, querido Mario. No
Thank
sé
you,
si
dear
quieren
Mario.
agregar
I don't
algún
know if you
punto
would
los
like to
amigos,
add
Manuela, María
anything,
Eugenia.
Manuela or Maria
No,
Eugenia.
sí,
A ver,
sí,
Well, yes,
María Eugenia.
yes,
sí, a mí sí me gustaría
yes, I would
agregar.
like
Lo
to
que sí
add
les puedo decir con
what
respecto
I
a
can
esta
tell you with regards to
estigmatización,
this
que cuando yo
stigmatization,
llegué aquí
that when
a
I
Quito,
arrived to
de mi
Quito,
pueblo, donde yo
from
no
my
entendía qué era el
village where I
racismo,
didn't understand what racism was because we were all
nos
the
habían
same,
hecho sentir nuestros padres,
they,
negros, blancos,
our
indígenas,
parents
en
didn't make
algunos
us feel
lugares
different. We were
yo
all the
había
same.
vivido eso,
So I
y
hadn't
cuando
lived
llegué
through that,
acá a
but when I
Quito me
came to Quito,
sorprendí al
I
escuchar
was
esto,
surprised
que
to
las
hear that
personas por hacernos
that
a
people,
nosotros los
because
tratos despectivos,
the
empezaron
Afro-descendant, they
a
use
llamar
some
negritos,
negative and they
¿no?
call us
Negritos,
negritos, little
morenitos,
blacks,
o cuando ponían
or
un
when
anuncio,
they
un
put
aviso que se necesitaba una
advertisement that
persona
they
para
need some person for
algún
some
trabajo, para
job,
realizar una labor, ponían que
they
sea
will
de
put
buena
of
presencia.
good
Y
presence.
dice buena
And by
presencia quiere
stating good
decir que no
presence, they
fueran
meant that
negros.
they were not black.
Entonces, todo ese tipo de cosas
So
han
that
sido
type
muy
of things
negativas
have been
adentro de mi
very
país,
negative in my
pero les
country,
puedo decir
but I can tell
con
you
tanta claridad y verdad
very
que hoy en
clearly and
día
truth that
existe
nowadays
racismo
there is
bastante.
racism. There's a lot of
Obviamente, cuando
racism,
yo
but
llegué
not as
aquí,
the one that when I arrived
ahora
here
yo
to this
miro
city.
que la gente
Now I
de
see
color,
that
como nosotros
the
también les
people of
llamamos,
color,
con
like we
todo
call them,
respeto,
or we with a lot of respect,
siento bastante aprecio,
I
respeto y
feel
amor
respect
para
and love
nosotros los
for
negros, en
us, the black,
especial ese saber que
of that,
nosotros somos personas
knowing that we are
fuertes, inteligentes,
strong,
sabias,
intelligent,
que sabemos
wise
muchas
persons,
cosas, además
that we know a lot of
del gran
things in
talento que tiene
addition
el
to the
fútbol, la
talent that we
cultura
have
y
in
muchas
football,
virtudes más, ¿no?
in
Eso les puedo decir con
cuisine.
respecto a eso.
I
Sí,
could tell you,
existe bastante, pero menos que antes.
yes, there's still some,
Muchísimas
but
gracias.
less than before.
Muchísimas gracias, querida María
Thank you,
Eugenia.
dear
Yo
Maria
les
Eugenia.
cuento que yo desde niña he
I
pasado por
can
mi
tell you,
mamá.
when
En
I
el
was a
colegio siempre
girl in
estaba
school, they would,
un gran compañero, digo ya
a,
hoy día, y me tocaba y
a
me
friend
decía,
of mine would touch
eres
me and said,
distinta.
I thought that
Cuando conocí
you were different.
el primer hombre que dije, yo puede
When
ser mi esposo, ya a los
the
17
first
años,
person, the
cuando me
person that
dijeron
I
a mi
met
madre,
that
cuando no había más que
I
negra, negra en la
was,
casa. Pero
she
yo
asked my
siento,
husband to be,
como
if
dice
there
Mario,
wasn't
que
another
eso
black
no me
people to bring to the
inhibe,
home.
y aún más
So
cuando yo llego a un centro de
when I
salud
when I go
donde
to a
me
health
hacen los
facility, and because
exámenes
I'm
que se
black,
sabe que yo ni siquiera
I
tengo
am
nada,
rated as with
pero
diseases that I
cuando me
haven't
dicen,
mentioned.
usted
That
es
but because I'm black, they tell me you have hypertension, and my pressure is always 100/70. And why do you have that pressure but you are black and you eat this and that? That's also a way of telling you that discriminate you. Something that I love that facilitates this change and transformation is when we start to consider knowledges. When we start to look at a person because of what they know, of what they do, and the knowledge, the color of the skin, it doesn't count. And there is something that I believe that is making some changes is the struggle that these Afro-descendants are working on, this fight we're giving to show what we are, show what we know, that there's some songs that in Colombia that said that black people running is a thief, and a white that runs is not a thief. So those things show me that there are changes. People want to change. Everything is in the mind of each one to think with respect with regards to the others. I'm sure that we insist in values, racism is going to be over.
Muchísimas gracias, muchísimas
Thank
gracias. Yo
you.
quiero hacerles ahora es llegar a una
Now I
conclusión,
would
no
like
sé
to
cuál, quién
another
quiere
question,
comenzar, pero me dicen lo
but
siguiente. ¿Qué
they ask the
estrategias de
following: what
inclusión
inclusion
existen para la
strategies
población
exist
afrodescendiente,
for the Afro-descendant
lesbiana,
population
gay,
that is
bisexual,
lesbian, gay,
transexual,
transsexual,
y quiénes tienen mayor
and
riesgo de
who have the
discriminación
higher
y
risk of
consecuentemente
discrimination
de su
and
deterioro de la salud
therefore of
mental?
their poor
¿Usted
mental
cree que usted
health?
podría
Have you
responder?
seen that?
Eh, si me permiten, yo creo que
I think that
es una situación similar a la que
it's a similar
mencionaba anteriormente.
situation that I
Mientras
mentioned
no
before.
tengamos
As long as we don't have,
la
while we don't have
visibilización, la
the
visibilización en materia de indicadores
the
sanitarios,
health indicators,
no daremos todavía el
we
salto hacia la
won't
mirada
be
de
go
determinadas
towards
necesidades
to
propias
look
del
at certain
afrodescendiente.
particular needs. I'll
Necesitamos
explain
primero
myself. We
ubicarnos en el
first need
contexto de
to
cuánto
locate in the
la población
context
afrodescendiente
how much of the
acude a
Afro-descendant
los servicios de
population
salud y
goes to
cuántas
public
de ellas tienen
services and how
necesidades,
many of them have
necesidades en salud. Y eso pasa
needs
por
in
lo
health.
que
And
indicaba
that goes through what I
anteriormente sobre el
indicated
código
with the
étnico
code,
en
the
el
ethnic code
registro informático de
record
salud del Perú. O sea,
in
ese
the
código es un código que el
clinical record
profesional
in
que
Peru.
atiende a la persona debe de
Is
registrarlo.
the a
Y a
code
su
that
vez
the
el profesional
professional that takes care
ubicarlo
of the
y
person
esos
should add
afrodescendientes
in.
de los
And
nuevos
so we
pacientes.
can identify who
Entonces,
is Afro-descendant and
partiendo
who
de
is not.
ahí y luego
So
del
starting from
corazón de
there,
todos los
and
afrodescendientes
then from all
tenemos
the group of
aquellos
Afro-descendants, we'll start to
que
look at
por
who came
necesidades
and why,
de orientación en
because they
educación
need
sexual,
some
por alguna
sexual
enfermedad crónica,
education
etc.
orientation or a
Entonces de
chronic
ahí
condition.
empezamos a ubicar
So
las
from there,
necesidades
we start
particulares
to
en este grupo.
determine the
El
specific
tema
need
que
for
tú
that group.
destacas, estimada Gloria, con
What
respecto a
you
las poblaciones
mentioned, Gloria,
afrodescendientes
with the
bajo este grupo,
LBTG
es
population,
transversal a cualquier grupo
is
étnico.
goes through any
Entonces, la
ethnic group.
población
So
afrodescendiente
the Afro-descendant
sufre
population
discriminación o
suffers
estigmatización por ser
the
afrodescendiente,
stigmatization
más
because the
por
Afro-descendant
ser
plus
LGTBI+.
the
Suma.
LBGT. So
Si yo no lo visibilizo
if
como
I don't
afrodescendiente
see
en
this
este grupo,
as
para después
Afro-descendant,
ir a mirar
and then
las necesidades particulares, entonces todavía tenemos un paso
and then
por
consider the
delante.
individual
Entonces,
needs,
yo creo
there's
que
something that we need to work
como
first.
país tenemos que
For
avanzar
the
primero
country, we need to
en la
first
garantía y la adherencia
guarantee
al
an
registro de
adherence
códigos
to the
étnicos
code
y no
registration,
solamente
ethnic
régimen
code,
investigador
registration code,
secundario para afrodescendientes,
not
sino
only
para
for
todas las poblaciones
Afro-descendant, but for
originarias
all the
de nuestro
original
país. ¿Qué
populations of our
permitiría
countries,
poder identificar, no con una,
will
como
identify,
muchos también me lo han preguntado, Mario,
not
¿tú no
as
crees que eso como
many
que
have asked me,
segmenta a la
don't you
población?
think that that
No es que la
produces
segmente,
segmentation of the
la
population? But that's
focaliza
not the
para
case.
poder ser mucho más
It
asertivos en la
targeted so
manera
we
de
can be more
responder.
assertive in how we
¿Por qué? Porque
intervene,
tenemos que respetar aspectos
because
que
we
tú
need
muy
to
bien,
respect
para mí ha sido muy,
aspects
muy, muy enriquecedor escuchar tanto a Lady como a
as
María Eugenia.
is
Todos
very
los
enriched
saberes
presentation
ancestrales
of Lady
todavía siguen vigentes en esos
and
tiempos. ¿Cómo
Maria
yo puedo
Eugenia with
saber
the
cómo
ancestral
rescatarlos?
knowledge.
Les doy soporte,
How can I
los
provide
rescato,
support
los
and rescue
capacito
them
si no los conozco.
if I don't
Entonces,
know
allí
them?
yo creo que
So
primero tenemos que
there
dar ese paso
we
para
need
ir
to
hacia
give that first
la
step
mirada de necesidades
to
particulares como lo
look at
es
the
el
special needs
LGTBI+,
as
que
the LBTG
tiene también
plus
necesidades
population
particulares
because they all have
transversales
their
del grupo
particular
afro.
needs
Muchas gracias.
that are transversal to the need.
Gracias, Mario. No sé
Thank
si
you.
hay María
Mario.
Eugenia o
I don't know if María Eugenia Manuela would like to add anything else. I fully agree how Mario has responded, but I would say that Afros looking at the LBTG community because of the body, the black person has a body structure that you say, this is a man. So they say, why is he dressing as a woman? So people say, what a waste. And they don't look at the respect that he wants to get. Who is he or who he wants to be? And because of being black, they only fixate on those attributes. And they say, no, he's wasting his time. This doesn't look well. And they start to stigmatize them. In other ethnic groups, this is not considered. So it's a different story who they're talking to. But with the black, it's being stigmatized more because of a stereotype in their body.
Perdón, muchísimas gracias, querida Manuela.
Thank you,
Quería
Manuela.
comentar algo
I
sobre el
wanted to comment
registro
something about the
en los centros de salud.
registration
Es
in
un
health
órgano
services.
de salud intercultural que
This is
da
the
un proceso
intercultural
de
subcommittee.
inclusión
We were
social
able
y
to
variable
have
étnica.
the 6
Sin
countries to
embargo,
include this variable,
reconocemos que nos falta mucho
but
trabajo
there's still a lot of effort to be
que
done
esta variable se llene de la
for
manera
this
adecuada.
variable be filled
Como
correctly.
señalaba Mario, la
As Mario mentioned,
autodeterminación es súper
the
importante.
self-determination is
Por
very
lo general,
important, but in general,
los equipos de salud o no
the
lo hacen
health
o lo llevan de
teams
acuerdo
either don't
a
complete
sus
it adequately
circunstancias.
or
Por eso
they
se va a
use
tratar de
their own
empujar a
perception.
través del comité,
So
desde
we
el
need to work
comité,
that
trabajar un poquito
work
más
this
sobre
more from the
todo con los
subcommittee
diversos ministerios de
with
salud.
our health
Bueno, voy
ministries.
a pasar a una pregunta.
Now, one more question.
Me dicen, ¿qué avances y retos
What
perciben las
challenges do
políticas
you
enfocadas en
participate in the policies
adolescentes y
focused
jóvenes
on
afrodescendientes?
adolescents
¿En qué
and young
inciden
Afro-descendants?
nuevas interseccionalidades, tales como la desigualdad
For
étnica,
example,
las
the ethnic
desigualdades de
inequalities,
género,
generation
etcétera?
difficulties for
Y
gender,
sigo preguntando, ¿cuál es la situación
and
actual
what
del
is the current
reconocimiento
situation
de la medicina
of the
tradicional
recognition of
en
traditional medicine
Ecuador, en
in
Colombia y
Ecuador,
Perú?
Colombia, and Peru?
Adelante, por favor.
Go ahead, please.
Lo
María
primero
Eugenia,
es,
tu
sí,
micrófono.
adelante. ¿Quién comienza?
María Eugenia creo que iba a empezar. Su micrófono estaba cerrado.
Bueno, gracias.
Well, thank you.
Gracias, Gloria. Yo quiero empezar
Thank you, Gloria. I would like to
la
start
última
with the
pregunta.
last question.
Yo siento y veo que
I
los
see
avances
that
dentro de
the
de la
progress
medicina
made
ancestral
in
ha dado un paso
ancestral
de verdad
medicine
muy
has done
agigantado.
a major
Hace
leap
muchos años
because
atrás no se
many years
hablaba,
ago
no se
we
decía
didn't
medicina
talk
ancestral,
about
se
ancestral
decía
medicine.
brujería.
We call witchcraft,
Y
witchery.
utilizando esa
And
palabra,
by using
brujería
that word
se
of witches,
orientaba a los grandes conocimientos y
they neglect
sabiduría
all this
que tenían
wisdom
los
and
pueblos y
knowledge that
nacionalidades, pero que
people's
hoy en día
nationality has.
vemos
But
el gran
nowadays,
compromiso
we see a major
de
commitment
los gobiernos,
of
no
the governments,
eclesiales, hablo de mi gobierno que
especially
es el que más
in my
conozco,
government
está muy al tanto,
that I
está
know
muy
more, is
comprometido de la
very
medicina
committed
con la
with
medicina ancestral, hasta el
ancestral
punto que la
medicine to
medicina
the point
ancestral
that ancestral
llegue
medicine can
a
reach
los estamentos, llegue
the
a la
different
escuela,
levels
que la
and
medicina ancestral
schools,
llegue
and
a
that
los
ancestral
sistemas
medicine
de
can reach
educación,
the,
porque
the,
ahora
the education
los
system,
pueblos andinos creo que se
because
están
all of
fijando
our
todo
Andean
lo que es la
countries,
educación,
they
la
are using the
etnoeducación, que
ethno
nos compete a
education,
todos.
ethnic
Dentro
education
de esto
that
está la
should
etnomedicina.
involve us, and we have
Como
ethnic medicine.
etnoeducación, una parte es
And part of its
desaprender
education is to
lo malo que aprendimos, ¿no?
get rid of
Todo
what
eso que nos
bad
enseñaron
things
sin
that we
tener el
learned
conocimiento de causa para poder
in
ahora
order to
dejar
now
despertar nuestra
wake
conciencia.
up our
Entonces es
awareness.
muy
So
importante
this
porque
is
ya
very
se está
important because this is being coordinated in the health system, and this should be worked on. We need to continue to work because in our countries we have WHO and PAHO, which are very interested that this ancestral medicine comes to light because that's the only way to save biodiversity. Big hand for all the countries that are considering this help to the other medicine and this help for humankind. Thank you.
Muchas gracias, María Eugenia.
Thank you, Maria Eugenia.
¿Seguimos? Sí.
Sí, bueno,
Okay.
hay algo de
There's something
mucha relevancia que podemos
of
señalar
relevance
de
that we can consider
nuestro, digamos, país,
the
Colombia,
country,
viene
Colombia.
avanzando muy
We're
rápido
making slow
en
progress.
diálogos de saberes
We're
y
still
investigación,
acknowledge dialogues and
pero se le ve
consultations.
interés
We
al Ministerio de
identified
Salud
the interest of the
del
Ministry of
gobierno,
Health
que
and
es
from
una
the
prioridad
government
para el
that
gobierno
is an important
esta
access for the government
coordinación de la
to
medicina
have this
occidental
coordination of
y
Western
oriental, como también es
medicine with
fundamental, y ellos lo tienen enmarcado
traditional
en el
medicine.
gobierno,
And this is included in the
digamos,
government plan
favorecer las minerías,
favoring,
darle con esa oportunidad a los
give
diversos
the
saberes.
opportunity to the
Panamá
knowledge
está
that
en diversos territorios,
some
pueblos
are located in different
indígenas tienen
territories.
sus propios saberes,
Afro-descendant and Andean descendant have their own knowledge,
rituales,
their own rituals,
acciones con la medicina
and
tradicional,
actions
lo
such
cual es
with
diferente a las otras
traditional
medicinas.
medicine that are
Claro,
different to the others,
el
but at the
mismo
end,
sistema de salud
together with the
es
health
el que se
system,
puede
we
organizar
see
y
that we can
complementar de una mejor manera.
organize and
¿Qué sucede? El
complement
tema de
each other
reglamentar no es fácil.
because
Necesitamos
regulations
en
are
qué
easy, but
momento
think at
reglamentar,
what moment
cómo lo
we
hacemos es
regulate
difícil. Y yo siempre
and
le
how
digo
we
a
do
los
it is
gobiernos de Colombia
difficult.
cuando tengo
And
oportunidad,
I always tell the
mire,
government
no
of
es buscar
Colombia,
cómo le pagas
don't
a
start
más de
thinking
5.000 sabedores,
how you pay more than
es cómo le pago
5,000
al que
healers.
ya
It's
ha hecho
how do I
la
pay
actividad.
the one that has
Y
carried out the
nosotros todo hay
activity?
que regularlo.
Everything
Queremos
needs to
que
be
los gobiernos
regulated. We
estandarte
want to
debemos
be
aceptar esa
recognized, but we
regulación.
also need to accept
Y para
regulation.
aceptar la regulación
To
debemos
accept the
sentarnos a la
regulations, we
mesa.
need to sit in
Porque
the
si
table
yo digo, tú eres la
because
partera, tú
if
atiendes,
I tell you
pero
you're
tú
the
eres regular,
midwife and you're the
pueden llegar
traditional physician,
charlatanes. Entonces, ¿cómo
they can be
regulamos
charlatans. So how do we regulate?
si hay marcas, voy a nombrar una
If
marca
there are
cualquiera,
brands
Adidas,
like
y hay gente
Adidas,
que dice,
people
es
that say
Adidas original y
this
este
is
es
original
réplica.
Adidas and this
Y
is a
dicen,
counterfeit.
Antioquia todo lo
And in
replican con
Antioquia,
facilidad,
everything is
todo lo
replicated,
transforman con facilidad.
everything is
Pueden transformar
transformed.
también un sabedor,
So
una
they can also
partera y
transform a
cualquier
healer
sustancia.
or a
Yo
midwife.
creo que la
So I
preocupación del
need
gobierno
the concern of
está en
our
la
government
regulación
in the
para de manera
regulation
regular,
so
pero
we can
se ve la
coordinate.
disposición
We
no
see that
solo por
there's
la
a this
sentencia que
not only
logramos las parteras
by the
tradicionales
sentence that
frente
we
al
traditional
Ministerio de
midwives
Salud,
achieved
pero
Ministry of Health.
más que eso, el plan de
More
gobierno
than
no
that,
está
the
implementado, cómo hacer
government
esta
plan
articulación,
is
pero es un
still in the
proceso
implementation.
que no es fácil.
This is a
No
process
es
that's
difícil,
not
pero
simple.
no
It's
es
not
fácil.
difficult, but it's not easy.
Admiro mucho
I admire
el país de nuestra compañera Maru.
the Maru
Conocí documentos de gran
country. I've seen
importancia.
significant
Tienen
documents.
código de ética para
They
todos
have
sus
an ethic
sabedores
code
y eso es
for
pura
their
profesionalidad. Eso quiere
healers.
decir, me les quito el sombrero y
And
quiere decir
I
que realmente
salute you
se han
because
dispuesto
you
a
really are
poder
ready to
acompañar e
strengthen
integrar
and to
el
integrate
sistema
the
de salud tradicional
traditional health
occidental que
system
ellos tienen.
in the
Y
Western
es
system that
regular.
they have.
¿Cómo lo regulamos? Así
They
que
regulate.
yo sé que esto es una ventana,
So I
una
know that
oportunidad
this is
para
a
nuestro país
window
realmente
for our
agilizar, porque este
country,
proceso desde la
make this
antigüedad
more agile,
siempre ha estado. Ellos mismos han
always been
utilizado
present,
tradicional
and they
medicina.
have used
Muchos
traditional
de ellos
medicine.
pasaron por parteras.
Many of
Yo
them,
nací con tres parteras.
I was
Yo
born
hago
with
parte del sistema
midwives,
de salud porque soy una
and I'm
partera
part of
tradicional.
the health
Pero
system because I'm
cómo
a nurse.
regulamos esto es
But
lo que
how do we
tenemos en la
regulate this is
cabeza de
something
nuestro
that
país.
we need to
Pero sé que con ejemplos
work
de
into.
países como
But
Ecuador y
with
Perú
example of countries
podemos
like
seguir
Ecuador and Peru,
avanzando,
we can
podemos
move
seguir
ahead, make
conociendo lo que están
progress,
haciendo
and
y
learn of what they're
necesitamos entre
doing.
nuestros ministros de
And
salud,
so our
nuestros
ministries of
ministros
health,
también de
our
cultura, de
Ministry
educación,
of Culture and
piensen
Education,
cómo y aborden,
think
conozcan cómo
they
Perú y
approach
Ecuador han
and learn about Peru and
han
Ecuador's
avanzado
progress
y poder mirar cómo ellos
and
también acá en Colombia
how
podemos
they in
aportar.
Colombia.
Gracias.
Thank you.
Muchísimas gracias. Muchísimas
Thank
gracias
you
por tu sincera participación.
for your
Adelante, Mario.
contribution. Go
Muy,
ahead,
muy
Mario.
puntual. En el Perú, el
Very brief.
Instituto Nacional de
In
Salud
Peru, the National Health
tiene
Institute
al Centro Nacional de Salud Intercultural.
has the
Y
Intercultural
desde este
Health
Centro Nacional
Center
de Salud
and
Intercultural
this National Intercultural
se
Center
gestan
where
muchas de
we
las
generate
evidencias
many of
para la
the
toma de decisiones
evidence for
en materia de
decision
salud
making
intercultural
in
para
terms of
diferentes grupos
intercultural
étnicos.
health for
Y
different
claro, pues el
ethnic
trabajo
groups.
que aquí
So we need to
se
highlight the
hace
effort
para
that's
población
being done here
afrodescendiente.
for the Afro-descendant
Instituciones
population.
que han impulsado
There's been one of
el
the
registro
most
étnico
important promoters
y
for
eso
this
lo reconocemos.
ethnic registration code, and we acknowledge that.
Actualmente se venían
At present,
desarrollando
we
la
have been
necesidad
developing the need
la reglamentación
and
una
the
nueva campaña
regulation
para
of
dar
Peruvian
información
standards
sobre el
regarding
origen
the
de los fármacos
origin of the
desde
drugs
la medicina ancestral y tradicional.
considered from ancestral
Ojo
and
que
traditional medicine.
en el marco del sistema de salud peruano,
And in the
la
Peruvian
seguridad
health
social,
framework,
el
Social
bienestar sano, que es
Security,
como se le denomina aquí,
I
ha
like
avanzado
we
mejor
made more
con el tema de
progress
la medicina
with
tradicional,
this
tanto así que tienen un
topic
área
of traditional
de
medicine. They
prevención
have an area of
nacional
traditional medicine
comunitaria, donde de alguna
where
manera en esta área de medicina tradicional
somehow in
recogen
this
una serie
area
de diferentes
they
aportes
collect different
étnicos que
contribution of
hacen del Perú
ethnic
tanto
health
andindas,
that make
amazónicas,
Peru
afrodescendientes
from the Andes, from
y
the Amazon,
culturas, mucho de la medicina
different
tradicional oriental, que
many of
también
the
se
Oriental
desarrolló
traditional
durante
medicine
mucho tiempo y
that
eso
is
con la migración
also came with the
asiática
Asian
al Perú y
migration
que se ha
to
quedado entre
Peru
nosotros. Entonces, qué
stayed
importante es
with
haber
us.
sabido
So
rescatar
it's
esto y haber
important to
hecho ese
rescue
sinergismo, esa
and
articulación.
to do that
Aspecto que
coordination,
todavía desde la
something
mirada
that
del trabajo que hace el
from the
Ministerio
look
de Salud
of the effort
se ha
made by the
logrado
Ministry of Health, we haven't been
consolidar.
able
Hablo
to
de expertos de la
consolidate,
seguridad social, ¿no?
been
Que
done
también
more in
es
social
uno de esos
security.
sectores dentro del
But
sector salud
at the end,
pública.
it's one of the subsectors in the
Ojalá
health
con
system.
esta regulación que
Hopefully,
se busca
with this
de
regulation that we're
trabajo para la
looking
Unión Europea, podamos
for
llegar.
drugs,
No
we
obstante, esto
can
ha venido
look at
caminando
this.
también lento. ¿Por qué?
This been
Porque no
doing
se
very
tiene
slow
todavía
progress
la
because
mirada
we
con el
are
interés
not
que se
still
debe
looking
en un
at
aspecto
with
tan
the interest
clave
that
como
it
es el
deserves
de la medicina
with
ancestral,
the
no
rescue of
solamente de los
ancestral medicine,
afrodescendientes, sino de
not
toda la
only from
población
Afro-descendant, but from all
afrodescendiente.
the
Por
ethnic
eso es
groups in
que
Peru.
nos hace falta allí ser más
That is
agresivos
why
en la
we need to be
regulación como
more
Estado
stronger in
para
terms of regulation as a
poder
state. And that's my answer,
Muchas gracias,
Gloria.
Mario, por tus palabras.
Mario, for your
Bueno,
words.
realmente agradecemos las
Well,
preguntas
we thank
realizadas.
for the
No vamos a
questions.
alcanzar a
We're
responderlas
not able to
todas,
respond all
pero
of
las vamos
them,
a tener en
but
cuenta
we will
para
take them into
definir los
account to
temas
define
de
the
los
topics
próximos
for next
seminarios, webinars,
webinars
reuniones técnicas que
and
tengamos.
technical meetings.
Valoramos mucho la
We value
participación e
your
interés de la gente que nos
participation and
acompaña.
interest.
Para cerrar este
To
espacio,
close this
me
space,
gustaría darles a
I
cada
would like
uno un
to give
minuto
you
para un
1 minute
mensaje final.
for a
Corto,
final message,
conciso,
short,
preciso. En el mismo
concise,
orden en
accurate,
que hicieron
in the
sus
same order
presentaciones,
that
por
you made
favor.
your
Un
presentations.
minuto, por favor.
One
Adelante.
minute, go ahead.
¿Me repites, por favor, la pregunta?
No, es que les doy un minuto
You
para
have
que
1 minute to give a
cortito, sin
final
prisa,
message.
nos dejen un mensaje final.
Más que gracias, es
More
decirle
than
cada
thanks,
oportunidad
to tell
de
you
identificar,
that any
identificar
opportunity to
cómo
identify and
saber,
coordinate with
aún
other
siendo de la misma,
knowledges,
del mismo pueblo, la misma etnia, permite
this
que
allows
crezcamos como
that we can
personas
grow
y
as
crezcamos
persons
como
and
humanidad
we
como
grow
país.
as humankind and territory.
Muchas gracias. Adelante, María
Thank you,
Eugenia.
María Eugenia.
Tienes el micrófono apagado.
Ya, les
Okay,
decía que dándole
I was
gracias a
saying
Dios,
that
le doy muchas gracias a
thanking
ustedes
God
y
and
les
I
pido
thank
que sigan
you,
adelante con
and
estos
please
programas.
go ahead
De
with this
esta
type of
forma
programs
podemos
because this is
conocer lo que es
how
la
we
medicina ancestral, los saberes,
communicate
las
ancestral
necesidades
medicine
que
and the
tenemos
needs
nosotros
that
como
we have
pueblos
as
étnicos.
ethnic
Esperamos mañana
peoples.
pasado
We
que
hope
si
that
acá en el
tomorrow,
Ecuador ya se hizo
that
una
if
ley,
in
que los
Ecuador
demás
there's a law
países
that's
les
been
sirva esto
enacted,
como un pedacito, como
please
modelo
take a
para
little
seguir
bit
con el
as a model to
conocimiento
continue
de la medicina y los saberes
creating the
ancestrales.
network of
Gracias.
medicine and
Muchísimas
ancestral
gracias, María
knowledge.
Eugenia. Adelante,
Thank you,
Mario.
Mario Eugenia. Mario,
En realidad agradecer a
to
los
thank
CONU
the Horas
por
Conu
tan
for
brillante
this
asertividad
brilliant
para ir a la vanguardia de todas las necesidades de las
attitude to
poblaciones
be on the forefront of
étnicas
all the needs of
que
the populations
representan.
of the other countries that they
Y hoy en el
represent.
Día Internacional
And
de los
today, in
Afrodescendientes, no
International
podía
Afro-Descendant
dejar de
Day,
estar presente y creo que
wouldn't
es
be, we need, had to
la
be
única
present.
conocida hoy aquí en el Perú, la única
The
organización
only
de carácter
organization
internacional
of international characteristics as a international cooperation agency for any country that has highlighted today with an activity such as this one, this webinar. This is something that's about the level of commitment that the Horas Konu has with the Afro-descendant population. It's important to highlight and mention it because that level of commitment is something that we want the other multilateral organizations and international institutions that have the commitment of monitor this compliance can do it through Horas Konu. We thank you for this space, Dr. María del Carmen Calle. You with this look that goes beyond of what needs to be looked at, and this is something that we like to highlight. And for me, this has been an honor to share with María Eugenia and Lady from Colombia and Ecuador, Afro-descendant sisters from the Americas. Hopefully in another space we will continue talking of what are the concrete actions that we can land in the benefit of our population, Latin American community, Afro-descendants are development. Thank you very much for this.
Muchísimas gracias, Mario.
Thank you very much, Mario, María Eugenia, Manuel.
Ha sido muy
Has been
importante.
very important to have you with us, as Mario indicated today. Once again, congratulations for you. We thank all the participants that week after week join us, especially the team of Horas Konu, and especially to Berta Luz, who supported, for the support provided. Thank you very much to all the people who have participated in this activity. That has been possible thanks to the commitment with Andean integration and Latin American integration. We'll give the floor to Dr. María Carmen Calle for closing this webinar on behalf of the Andean Health Organization Hipólito Agreement. Go ahead, Dr. Calle. My first words are to thank María Eugenia, Lady Manuela, and Mario. One feels satisfied when you see that what you started so many years ago, little by little, is becoming a reality. In 2008, 2009, the Ministry of Health, and I was as an advisor to the General Office of Promotion, to the first standard of gender intercultural rights approach, because we were fully convinced that everyone, with no exception, have the right to a higher level of health. Then we were part of many initiatives, and when we start working in the Andean Health Organization, we saw that Gloria and Berta also were considering this intercultural topic, and there is a Afro-descendant subcommittee, and there's also subcommittee for intercultural health. Honestly, we need to continue. We need to continue this path because we're all the same, but we need different things. I always say we cannot treat the same those who are different. What we need to achieve is that everyone can have the right to health and well-being. Mario also reminds me 5 or 6 years ago in a meeting with the International Association for Adolescent Health, I was saying, why don't you put well-being? But Marie Carmen, just health. Said, no, we need to include well-being. And if you see our recent documents, it's very clearly stated, health and well-being, because we are fully convinced that this topic is not just health. This is something that goes more complicated. There are determinants. You've mentioned it quite, I don't have anything to add. It's been very clear in this issue of social determinants and discrimination that's still not over, and this issue of abuse. We should all be treated adequately. And this is mentioned by the Committee on the Right of the Children. The first children come first, and they should be educated and be healthy and not undergo violence and be listened and treated with. So we all have to receive treatment, be treated adequately. And I've been very emotional to mention Ubuntu. I talking about Ubuntu for many years because I had a fortune to be in Africa in 2000, and I love that I am if everybody else is. That concept that's so valuable that you have in Africa, and then now we made it of part of our own. And also this dialogue of knowledge, everything that implies interculturality, dialogue of with respect. But we sometimes forget that we dialogue, but we don't respect. And you have show it perfectly when they come to a health facility, they're treated differently. You've been very graphic in that regard. We made progress. I don't think that I think we made progress. There's still a lot to do, many things to be done. So we need to work much more. It's been an honor to hear you. I'm very happy because I feel that all these people that have been here,
Más de 300 personas
we have more
conectadas.
than 900 people connected in countries. I'm very happy because we've seen the presence. We're doing simultaneous interpretation, and there's been a lot of presence in the channel. Because what we do here should be learned and known throughout the world. Vision of the organization is well, we work in the Andean region, and these are the most important countries for our effort. But we have to consider Ubuntu. We are if everybody else is, and we are part of the world. Thank you very much, Gloria. Thank you very much, Bertita. All the Andean Health Organization made this webinar possible, and we invite you to our upcoming webinar next Thursday at 11 a.m. Please keep in touch with us. Once again, thank you very much, Mario Eugenia, Lady Manuela, Mario, and see you soon. Bye-bye.
Mario, Manuela, Gloria, todos ustedes.
Bye-bye, everyone. We love you.